A very warm good morning to one and all. Welcome to the second day of National Seminar on Innovation through Interdisciplinary Approach in Healthcare Practice. It is sponsored by AICT and organized by National College of Pharmacy. Today we have another exciting lineup of sessions planned for you.
Now, let's start the session of the day titled Discovery and Development of Novel Nanobiotechnology Products Based on Magnetic Nanoparticles for Genomic and Proteomics Research and Application by Dr. C.N. Ramchand.
Before going to the scientific session, I would like to introduce the session chair, Mr. Agil Hari. Mr. Agil Hari, Professor, Department of Pharmaceutics, National College of Pharmacy. He is having more than 14 years of experience in academic. He has various publications in national and international journals. We invite you, sir, for chairing the session.
Thank you. Good morning, one and all. So, my job is to introduce our today's speaker and say a few things about the topic. So, I went through his profile. So, 5 minutes is the time given to me to introduce the speaker, but 5 minutes is not enough to introduce our speaker because his profile is so large and his achievements are larger than his profile too. So, few important achievements of our speaker. So, Dr. Ramchand, C.N. Ramchand, he did his bachelor's degree from Alapi SD College in the year 72 to 75. And he also a master degree in chemistry from University of Kerala. And he did MPhil and PhD from MS University, Baroda, and he also served as assistant professor there. He has won Young Scientist Award from Charing Cross and Westminster Medical School, UK for 3 times for his work in schizophrenia. He has extensive experience in basic research activities, having handled prestigious projects in US and UK, both in academics as well as in industry. He has over 25 years of rich experience in areas of teaching, research, drug discovery program, guiding MSc, PhD scholars, and setting up research facility. He has published over 70 peer-reviewed papers in international journals, edited many books, has around 15 patented products currently in the market, and holds close to more than 60 granted patents. He has done over 100 research presentations at many international conferences. So currently, Dr. C.N. Ramchand is CEO, CSO, and co-founder of MacGenome Technologies, which is in India as well as in San Francisco, USA. He's also CEO of Theragen Molecular Innovations and CEO of Saxon Life Sciences, Chennai. He is key advisor to several companies like Genome Labs, MedGenome, and holds position of director at Theragen Life Sciences. His visiting professor, PhD guide, Swinburne University, Australia, and Sarathar University of Science and Technology, Gujarat. He is currently involved in development of extensive PhD programs for students in collaboration with Swinburne University and IIT Chennai through Genome Labs coaching. So it's my honor to introduce our speaker. Let's say a few things about our today's topic and the relevance of the topic. So actually, I am from pharmaceutics department. Our department focus on nano research. In fact, our principal and they are planning to start a new nano lab which is exclusively focused on only nano research and which is equipped with all the facilities for nano research. So, and currently, if we are looking through our PG projects, most of the students are, in fact, all of our students are focused, they are choosing nano research only. And our research scholars, faculty who are doing PhDs, they're also doing in nano because the field is emerging over last last decades, the field is emerging and there are a lot of scope in this area. So today's topic is discovery and development of novel nanobiotechnology products based on magnetic nanoparticles for genomic, proteomics, research and applications. I hope this topic will be an inspiration to many of the PG students faculty who are currently pursuing PhD, who are anticipating to do PhD, uh, nano medicine, nanotechnology, uh, nano formulation. They are currently there are a lot of areas to be worked on. So I hope this will be an inspiration to you to take up projects in nano formulation and nanotechnology. Thank you. So let's welcome our today's speaker, Dr. C.N. Ramchand. Sir, please.
Good morning to everybody. Good morning, Dr. Akhil Hari, for the introduction. Thank you. I know that you lost quite a lot of time for that. It was not necessary. And thank you, Dr. Sujit Verma, as well as Dr. Sijo, Professor Sijo Pattam. I was not knowing that, he was also involved in this conference 2 days back only. Then I sent a message to him. The reason is that I know him for the last 25 years. The only thing now last 10, maybe after 5-6 years we are meeting, I think, isn't it? Yeah. Because his sister, husband is my childhood friend. So I'm really delighted to be here, especially I can see him too. So this is not my first visit to Calicut. I've been many times here, but I used to be a speaker at the Kerala Literature Festival. I don't know anybody who has attended last time. If you know, one Nobel laureate has come, Professor Adayonath. I interviewed her, and I also gave a separate talk on the fallacies in medicines, those area. So I'm really happy that, I could come here, and then I realized that, after talking to Professor Sujit Verma, you also have a startup program that is actually going all over India, especially in Kerala, because I'm involved with multiple startups in Kerala too, and many committees, not only Kerala, also in Tamil Nadu also. So today's talk, what I'm going to do is that is actually really a translational work, what I have done. That's why I thought this particular topics might be interesting to you. Is actually a work which is done in university. The first work I have done this in UK when I was there, but this was not my major work. I was working on basic mechanisms of disease, and connected to that. At that time I was working on schizophrenia, depression, mania, manic depression. We were trying to develop the mechanisms of this disease and develop the drugs for that. This was a parallel, very interesting work, but it's actually a physics, nanoparticle, magnetic nanoparticle, triferic tetroxide. Then over the period of time, lot of work was done, and parallelly I was lucky because after I came from UK, I was in industry. I was head of Sun Pharma research. I was allowed to guide PhD students. Interestingly, one of my students over there was registered with MS University Baroda, has done on magnetic nanoparticle, and lot of work was done. He published 12 papers, several patents, and now he is director of LONSA. Is now not working with nanoparticle, but something different. Then many other students did that one. So what I wanted to tell is that those who are going for PhD, make sure that some translational work is happening. And also this is the time. The lot of startups are coming. And if you are interested, you should get involved in that one. And I thought that, maybe few slides I was not knowing. I just wanted to just go through or glimpse through that slides. But then today I was told that, you are also involved in a lot of startup, and you got one of the greatest award from Delhi, I think. IIT Mumbai. So I saw that certificate. That's a great thing. That is an inspiration for all of you. Now, whatever I am going to do, I have two talks. This is one nanotechnology. The other one is really a biologics discovery and development on VEGF, anti-VEGF a fab molecule what we developed for wet AMD and diabetic retinopathy. Very first time in India. Probably you might be knowing drug discovery is not that easy. One of the most complex thing. In a simple way, you can tell India has never developed a single drug till date. Novel drug. Only 7 countries could make. In that background, how we done that, which is a second talk. So, and normally these type of talks are 20 minutes, 30 minutes, and you will rush through. I never like that one. So at least whatever I am talking, I can explain properly. The other thing is that at any point you have any questions, doubt, please ask. So that's also important, and I will know that, how far you know, what all things I know. And in one of the major problem as a startup company, what we are facing, we have 5, 6 startups are there, multiple places. We are not getting people, unfortunately. In order to somebody to be appointed in a startups, you need to have multiple understanding. For example, we start with very, very simple questions only to students. How to make, for example, 0.1 molar phosphate buffer pH 7. Can you imagine? Nobody has answered. And very simple questions. I can tell you, if I ask you 5% glucose solution, how to make 5% glucose, I can tell you, guaranteed 50% goes wrong. How to make 20 millimolar glucose solution, that also a large number of people fail. Forget about that advancing. We never ask that advancing. Even if we ask that, what really they know. So this is one of the problems in startups. So if you have an interest in startup, what you have to do is that you need to have a very good team, and that team members should be multidisciplinary, because that product development is not the, one single thing. There are many, 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 many things on there. I was a scientist and I thought that discovering something is the greatest thing. Now I realize that discovering something is the easiest thing. You know what is the toughest thing? After making something, how to commercialize that, how to get into the market. You might be knowing a very simple concept of even restaurant. What is the failure rate? 90% restaurants normally comes up and goes. You might be knowing, and some of the restaurants really comes up. 90% fail. Do you know what is the failure rate of startups worldwide? Worldwide, biology related, life sciences, biotechnology related, not IT related, which most probably will be successful. But one which is biopharma, biotechnology, or similar to what we are telling, 95% is will fail. But which everyone knows. But even if you are failure, one thing is that you are going to get a lot of experience there. Just thinking that there is a chance of failure is very high, don't stop it. Because during that time, that you learn a lot. But then in our case, luckily we were successful, because probably we have selected the project like that. So as I mentioned, when you are starting, what you have to see is that, is there a commercial opportunity? That is what you have to do. And the other thing is that what you have to make, is it going to be a commercially successful? Then what you have to see is that, is there a requirement in public or the people who is going to use? The second thing is that, is this product better than the existing one? This is what I am going to explain to you based on some of the product what we have developed. So I will come to that. So I just wanted to tell few things about that, and I will just briefly tell you about how to start a startup. Few slides are there, but then if anybody has questions, doubts, you can ask. Then I will also tell you the discovery and development of novel nanobiotechnology products based on magnetic nanoparticles. Magnetic nanoparticles is triferric tetroxide. It's a very simple product. You all know about nanotechnology. These magnetic nanoparticles are Fe3O4, which is paramagnetic in nature, and you can make whatever is the size. And how we have used that? Do you know in COVID times, you all might have done RT-PCR test, isn't it? Everyone knows RT-PCR, but RT-PCR is the last part. First is viral transfer medium or molecular transfer medium. You might be knowing that, putting into the liquid, that is VTM or MTM. Subsequent to that, RNA extraction. That RNA extraction, during that time, there was no automation was there. Automation in the sense means, hundreds and thousands of samples, because this diagnostic company had to deal with about thousands of samples. So everybody was doing one by one at that time. Now this company, this is a part of startup I'm just telling. So after that I will go into the real subject. So our company was slowly coming to at the level of break-even. Break-even means we don't have to externally put money. So we are almost coming that time. Suddenly COVID came, everything collapsed. The complete sales, everything stopped. Then we decided that can we develop the kits for COVID. Then what was happened that, we started doing that. We could develop complete VTM, MTM, RNA extraction, RT-PCR, all the things in 3 months' time. The next challenge what we faced was getting the approval. It was extremely difficult because National Institute of Immunology, National Institute of Virology, Pune, they are the one who has to test it. And whenever we sent, either they told no or this is not working. Then it was through a complex process. Finally, they got approved all our product. That means VTM, MTM, RNA extraction, RT-PCR with 100% sensitivity, 100% reliability. And that's only one product which has been having got that one. Because before that we went to Rajiv Gandhi and asked them to test independently and they tested it. So I'm just telling the complexity is not developing the product, getting the approval, then finally getting the commercialization process. So this we have done. And at that time, that using physical, not by automation, in the lab, one sample extraction kit was about 450, 500 rupees. That's why you are having about 2,000 plus rupees at that time. Then we introduce all these VTM, MTM and RT-PCR plus RNA extraction. So RNA extraction was mainly coming from Coagen. That it was slowly people started, because the first part gets then they did that. Then because the cost of this production is very less. The price, and we sell 25 million. It's about India, but in Chennai, then in Bombay, in Kerala, and many other places. That's the reason the price has gone down, especially in India throughout. And now it is 400, 500 rupees, isn't it? Okay. So I just want to tell the startups, Then we could sell that one, and so many other products we have introduced. The only thing is that during COVID time, we did not stop working because everybody was working, especially this these kits and sending it to all this. It was a very complex thing, and we did that. So I hope you understand what is genomics and what is proteomics and what is its application. Have you heard something called next generation sequencing? Anybody knows next generation sequencing? This is the water I know. So anybody knows next generation sequencing? Do you know what is the diagnostic procedure now? Which is basically the biochemical, or either by blood pressure or heart rate or those type of things, or biochemistry, urea, uric acid, creatinine, enzyme, those type of things. But do you know that these are shifting now, genomic based, especially cancer therapeutics. Pharmacogenomics, somebody knows? So just, I wanted to tell one thing, the way which diagnosis is going to shift now. Most of this diagnosis after some time will be based on DNA sequencing or RNA sequencing. There is something called precision medicine. Precision medicine means really you have to inject or give the medicine based on your genomic or SNPs or single nucleotide polymorphism or the variants which is present. So that is what all about genomics. Proteomics, the protein analysis. Okay. Basically, there is proteomics technology is there. That's a very upcoming technology, especially if you want extreme small quantity of protein to be detected in blood. That is some of the work what we are doing. So what I will be telling is that this nanoparticle mainly used for this genomics and proteomics research and its application. Do you know what exactly is an entrepreneurship? Anybody can tell? What is the difference between an entrepreneur, a businessman, and an industrialist? Can anybody tell a name of an entrepreneur? Very familiar. Then you will have some idea. Do not worry about the slides because I will overlap and so can somebody tell the name of an entrepreneur? You are telling something, so I can't hear. Yes, please. Name of an entrepreneur. Have you seen these people? So who is an entrepreneur? I know all these people you might be knowing. He was my boss for some time. Correct? These are all entrepreneurs. He's a businessman. Dilip Sanghvi, he was my boss for some time, 5 years. Chairman, he was the richest Indian for 3 years. But now he is the 4th richest man. He is from Kerala. But he set up everything in Gujarat. Gujarat is the center. By the way, do you know that? That's what when I was coming today, I was discussing that. How many pharmaceutical companies are there? So many pharmaceutics or pharmacology or related students are there, and maximum students are coming from Kerala. But how many pharmaceutical companies are there in Kerala? Recently I did an industry conclave because there is something called Kerala State Industrial Development Corporation, Kerala Life Sciences Park. I'm one of the directors. So we have done an industrial conclave and we wanted to have a lot of biotech people and biopharma and pharmaceutical. There was not a single pharmaceutical company from India. What I'm telling is that maybe here and there few, but really I have not heard about this thing. On the other hand, 55% of the company is in Gujarat. The remaining 45% in Hyderabad, then few in Bombay, few in Chennai, and few in Delhi. This is the locations. Why in Gujarat so many came? Have you heard of Sarabhai, the first pharmaceutical company in India? And some Sarabhai, Alembic Chemicals came, Alembic Pharmaceuticals. And because, if there is a cluster of these companies, suddenly from there, other companies will start coming. This is what has happened in Gujarat. 55% of the largest company, and the largest company in India, which is one of the biggest in the world also, is in Gujarat, which is started by Mr. Dilip Sanghvi. And the first the sale was only 3 lakh rupees, that he made lithium orotate. Now it is about 60-70,000 crore. About 60-70,000 people are working in the company worldwide. 168 locations are there. So he is the man who introduced, I'm sure, Verghese Kurian, Kerala. What did he do? Have you heard of Amul? Milk Revolution. You should read that one. Of course, nobody wants to know. Everyone knows about Dhirubhai Ambani and his 2 sons. Who is he? Amazon, Everyone knows that. All of you are using Facebook, Apple, Microsoft, and the richest man in the world. One unique thing about all of them, they are all entrepreneurs. And just see, someone who envisions, who has a vision, they normally creates from nothing, from something, from idea. Executes. The most important thing is you can have thousands and thousands of ideas, but how to get this executed is very important. That they are absolutely crazy about. You all might be knowing what is he crazy about now. Of course, that electrical car, and people have been trying, but he wanted, and I don't know, some of you might have gone to US, you can see that Tesla, you can sit and without a driver start moving, because I was there couple of months back. Then what is his other idea? Yeah, spacecraft. So these are real entrepreneurs. And another thing is that they have an idea. They may not be very educated, not necessarily, because they have idea and envisions. They know how to execute that project. And they are not crazy for money normally. It's not necessarily for money. They always want to help people. Those type of things are the idea. Can be a product, process, service, and technology. Any of this can be. Because it's not necessarily product alone. It can be processes, services, technology, because this can be probably a technology or a process, isn't it? Or a service, it can be. Then another explanation is that someone who mixes passion, innovation, and drive to turn a vision into a working business. That's what you have to do. You need to have a passion and need to have an innovative mind. But the most important thing is that, how to execute the project, which I will be telling few things on that. Then another explanation is someone with a drive, persistence, and mindset to change the world by filling a need in the marketplace. So this is another explanation, this thing. Now, how many of you are interested to do or become entrepreneurs? 1, 2, I saw. 3. Yeah, 3 people. 3. So which is probably 1.5%. So I don't know. But if you go to Gujarat, maybe 5 people will sing, because many of them are interested, And only 5% of adult Indians establish on business. It can be any type of business. What we are talking is about not entrepreneurship alone. It can be a restaurant also. In reality, only 1 to 2% students are only interested in entrepreneurship. That's what we have seen here. But I thought that it is changing. And few years back, when I was doing my PhD, when I was studying, you have no idea. And I realized that many people told me, why don't we start something, because always thought that job is the best thing, getting a good job. But now things have changed. At that time, really people thought that, an entrepreneurship, I don't know whether that word itself was there, but everybody thought entrepreneurship, business is like, running a shop. But things have changed now. So this particular report has come in 2018 by Global Entrepreneurship Monitor. So I thought I will just explain to you, but still people have to change that ideology, the way which they innovate things and introduce product in the market, all has to be changed. And I think many people, because Many translational research units are coming in universities, colleges, and everything. This is a part and parcel in United States, Europe, most countries. Because one of the major thing is that there is a translational department itself will be there. So if you have an idea, you will be able to go and introduce that over there. Now, this statistics is an old one, so this is wrong. Number of startups started in 2018 is 1,200 in India. That's wrong. The very recent thing is that in Kerala itself, there are 1,500 to 2,000 startups are there. Probably it is increasing. More than 1 million new ventures were started in US in 2018. Effectively, USA number now has around 27 million entrepreneurs. You might be wondering, how many people are there in US? 350, less than 400 million. So every year 1 million people are starting their own entrepreneurship. It is very, very common. The reason is that in universities, even students can start there. There is facilities are given. Staff can do because they can own the patent. And if the company becomes they can shift, they can become CEO, and the universities will fund for that. The government funding is there. Not only that, many other this thing. This is what we have seen that, entrepreneurs. The greatest entrepreneurs are coming from US. If you see anything and everything. And, all billionaires are coming from there. And mainly through entrepreneurship and novel products. As I mentioned, the drug discovery, 70% of every drug, novel drugs are coming from US. The reason is that they support innovation. Now, entrepreneurship in India. This is one of the reasons. I think earlier nobody wanted to get married somebody who is wanting to start a startup, who can be a doctor, engineer, professor, whatever it is. I'm not going to do, I'm going to start up. I don't think that guy can get a girl. This was true. Because everybody wanted, or every parents wanted to get their daughter get married to somebody who is employed well. But things are changing. Lack of respect. As I mentioned, entrepreneur is a businessman. Education loans. This is another thing, because many people now has to take loan. And if you start another, they have to take loan or, get money from family and friends. That's a problem. Stay-at-home spouse. This is not if you want to start a startup, what you have to do is that both should work. I mean, both should be employed. It is best that, husband is going for an entrepreneurship. The wife should work so that you are protected from whatever is the monetary requirements. Academic block, which is changing now. That's what I was told to explain these things to you. That's what I am giving. So that academic block, in the sense, means academics thought. When you are in a university or we are studying, learning, teaching, or whatever it is, the best is to go for a good job. If you have done medicine, go as a doctor. If you have done an engineer, go in an IT company. Things are changing now. Mindset of the society. Society thought that, as any entrepreneur is a businessman. That's not a good thing. Things are changing. Fear of failure. Yeah. Many people, as I mentioned, that, you know very well that 90-95% will fail. But then, everyone knows that even those who are investing, VCs, they know that the chances of successful bringing out a product is not that easy. But what you are going to get is that, you are going to learn a tremendous knowledge how to run the company, how to start a startup. There are so many things, at least about 30-40 different things, right from naming of the company to form the ROC, going to register of company, then articles of association, memorandum of association, plus an HR department, getting the people, train them. There is lot of things to do. Then you need to identify the money, then accounts has to be done, then you need to have a facility. So a lot of things are there. But now the government also is supporting tremendously. Many universities, many colleges, these type of things are there. Then lack of startup advice and family liability. Yeah, that is another thing that, for example, I can advise, I know in and out when you start up this thing. So those type of advisors are required. And you can't get an advice from somebody who has not done. It is best to, whether it is was a successful entrepreneur or no. But you need to have an advisor. It's very important. So this is a typical example of businessman versus entrepreneur, an industrialist, which you all know, Ratan Tata. So there's a difference between businessman. Businessman wants put money, get money back. An industrialist thinks slightly different way. He wants to set up large industrial conglomerate, like in a car factory, and thousands of people can be employed. That is what an industrialist thinks. Now, this is another important thing. Unless you have these 3 P's, do not start. That means you need to have passion, purpose, and profession. Now, I can tell you one thing. There is nothing as good as starting a startup and making it successful to unravel the complete potential of a human being or a scientist or a student. The reason is that it's very different that you are going and working in a company or doing something. But on the other hand, if you start a startup, you can see the way which you have transformed after 5 years. The level of your understanding, the level of people who you are dealing with. So, the unraveling the full potential. A person who has never done the accountancy will have to do accounts also. A person, now I realize that the last thing I was involved in business development. For MacGenome, now I am getting involved in the business development part also, which I was not interested, which I was not doing anything. But now we have set up a facility in the US, San Francisco. So I went there 1 month, setting up that one, meeting up people, because getting or initially selling the product is not that easy, especially in the US market. So what I wanted to tell is that whoever it is, if you start a startup and in 5 years, the way which you have transformed yourself is very different. The other thing is that I can also tell you one thing. If you go to a startup and start working, or if you have started your own startup, you will never ever go and work a day. You can see the history. You might fail maybe 4 times, 5 times, but then you know that you can be successful and eventually you will be successful. So this is some of the things what you have to think about. So this passion. You need to have a passion to do that. Some people want to educate people or start up a school, college. Yesterday, 2 days back, somebody came to me. She's working in a Pfizer and she wants to close that one. She wants to start a school. The reason is that she does not want to take much money at all and every student can join, right? So very good idea that can be successful. So that type of passion is required. Your passion can be in science also. There should be a purpose. Purpose can be, many people come out with the purpose that I want to employ so many people. I want to see that, alleviate the poverty or those type of things. And profession. This startup, the work you are doing becomes your profession, great thing. So you remember these 3 things and the unraveling the potential. The greatest thing is starting a startup. Now I am asking a question. You think what is going to be the most important thing? There are many things are there in a startup. Somebody will have to tell me, and if possible, the reason. Whether the idea is important, whether the team is important, the business model is important, the funding is important, and timing is important. There are many things more are there, but this is some of the important things. Some students can think, anyone, at least you might be having an idea, some idea this, one of this can be probably the most important thing. Definitely all are required. Without idea you can't start. Without a team you can't do. A business model is very important. Funding is again important. And the timing is also important. But which is more important? The most important. Or I will tell you, in the US, there was a survey was taken. This was about 6 years back. This is the answer to that survey. The survey was taken about 100, 200 companies, 100 companies which grew beyond any doubts. The other 100 companies with the same way but failed. So from they came out with the conclusion. What's the most important thing? Somebody tell me. Yeah, somebody was telling something I can't hear. Timing, very good. Who told that? Very good. Okay, so two important things came out is that, the timing and the team. Now, timing, for example, do you know Infosys, one of the earliest startup, one of the MD was my classmate also, Shibulal. Shibulal was studying with me in SD College. Then I know the stories behind there. Seven people were there. Then eventually 5 people. But why that is such a successful company? But after that, even much better people started. During that time, whichever the IT company started, they boomed. Infosys was one of the examples. But it is very difficult. Someone starts like that right now to become something like as a startup. So the timing is very important. But another most important thing is that team. If you are starting a startup, you need to have a right team with you. You can be very good friends. It does not mean that you can't argue. And you should believe in each other. And normally you need to have kind of skills, attitude and adaptability to the situations. So team is going to be very, very important. And this is one thing I have learned during that, last, as my entrepreneurship, this thing, and in industries. For example, in Sun Pharma, I had 600 plus people who were working at one point. The selection of the people, because otherwise what will happen is that after some time, the tremendous, insecurity feeling comes up. I have no idea why. Everybody, this thing, and some kind of, fighting and other things. And if this happens, then everything can collapse because people will resign that. So one of the things is that, keep the people together. That's why many people take everyone to some other holidays and other things. So it is very, very important, this team. So if you are planning to start a startup, you need to have some very good friends, believe in each other. And as I mentioned, if husband has started the startup, then let the wife work elsewhere in a job. And if they have a baby, let that baby be taken care by grandparents or something. So this is the way to start. Because this is the questions they face many times when we are starting this thing.
The business model is also important.
No, all are important. I'm not telling. When that survey was done, number 1 came timing, number 2 team. All other things. And many more things are there. Many more things. There are 27 different points were there. And these came number 1. What they told is that, why it is successful, or if Jeff Bezos is successful as an Amazon CEO, so this timing is right. And one more company, that is Alibaba, who started in China, is also very successful. Then few more. Now many are starting. It's not coming out. because the timing is gone. I'm not telling, that's a several billion-dollar company, Amazon. So it will be very difficult because the timing was very important. Now, why startups fail? These are the again statistics. You can't start with a product where there is no market need. Now, I will tell you as an example of our nanoparticle because we wanted to make sure that at least somebody will buy that. And if you are introducing a product, especially somebody is already using that, it is very, very important that, it has to be better than the existing one. And not only that, there should be a market need. You can't introduce a product which there is no market need. If somebody introduces another biryani in next to Paragon, I've gone there sometime back, so I know the queue and other things. Is it going to be successful? It is going to be impossible. But then if you want to be successful, that biryani has to be far better than Paragon. Far better, and 100 people have to tell that. Then it has to be, because somebody should get that idea, why don't I go and eat? Because 10 people have to tell. The cost also has to be less. So this is one of the things what you have to think before starting. Market need, run out of cash. The most important thing. Many people, what will happen, they have money. They do not think, I am going to market this product after 3 years or 5 years, but they have money for 2 years, then they start running around for money. After 2 years or 1.5 years, that will not work because you should have anticipated this much in advance. Then not the right team, gone. If your team is not good, again gone. Get outcompeted. Somebody else comes and comes with a better product. Cost issues. You can't introduce the biryani in a Paragon is 100 rupees and another person, a sub-quality, introduces 200 rupees. Not a single person will go there. Then user unfriendly product. You have, whether it is a product, it has to be very easily usable. Very good examples are there in developing the drugs, molecules. Now you can see every drugs 5 milligram, 10 milligram, 20 milligram. Earlier it was 500 milligram. Now somebody introduces a 1 gram product for something and 4 times you have to take, or 2 grams morning, 2 grams afternoon. That will not be successful. Company much earlier will decide this will not go ahead. So it is very important. Poor marketing, of course, the marketing, branding is one of the most important thing. Then ignore customers. You always have to hear what the customer wants and what is the problem. Especially if you have introduced a product, you have to do that. Then product mystified. That means, the product does not go ahead as expected. So this I will tell about some of our startup companies. I will briefly tell, then we will go into the I have only one request that don't use mobile when I am talking. I normally go and tell everyone. If you want to use, make sure that I don't see it, because I normally look at the people continuously, because I will lose my attention. And if you are attending that, because these are all these are random talks. In the sense means, it just comes like that. So I need kind of attention. I'm not because anybody was using, I'm just telling. This normally, I have seen that the student sitting is extremely disciplined here. So I just wanted to reiterate that. So these are some of our group companies. Sci Genome Research Foundation. I don't know, you might have heard about one of the conferences we used to conduct, NGBT, Next Generation Biotechnology Biopharma Conference, which we have done about 10 all over India, including Kerala, Delhi, Bombay. Kerala twice we have done, in Cochin and Trivandrum, RGCB, and the other one was in that hotel with Kerala University, sorry, Cochin University. Then Sci Genome was the first startup company. That's an incubation company. If you want to incubate with your idea, You always can come there. That's at Cochin. So many of our companies have started from there and came out. So it is like an incubation place with all facilities are there. And we also identify funding, but then your project has to be approved. So we know that what type of project can be successful. So genomics R&D services, antibody research and incubator company for novel technologies. I'm sure you would have heard about MedGenome. MedGenome, if you see, is the most successful biotech company in India currently. If you see top 10, number 1, number 2 comes MedGenome. MedGenome is first introduced as the next generation sequencing company. Now it is also in San Francisco. Every hospital sends for sequencing. For example, many diseases that, if they are unable to identify, like for example neurological disease, but using phenotype it will become very difficult, and they send the sample. You just have to send the sample, sequence, the bioinformatics people will tell, pinpoint that this can be this disease. Then agri-genome, mainly agricultural genomics. Saxon Life Sciences, that was the first fab molecule what we had developed for diabetic retinopathy, which is in Chennai. Then Terajan Life Sciences, you might be knowing ANDA, the pharmaceutics people should know about it. Who are the pharmaceutics people? ANDA. Because, see, after generics, this is the one which all top pharmaceutical company makes money. Abbreviated new drug application. There is various stages are there. APIs are there. Then generics are there. Then generic drug delivery is there. ANDA is there, abbreviated new drug application, which is actually drugs to be introduced in the US market. Then comes, of course, Me Too drugs and new drugs and biologics and biosimilars. These are the various categories. So, Terajan Life Sciences is an ANDA company. Then Terajan Biologics, we have involved in developing fab molecule, an antibody, fraction antibody for diabetic retinopathy. And we have first got about 5 crore grant from National Biopharma Mission. Probably you should also get involved in such this thing, but you need to have the basic this thing. We are the only one who was selected for that. Now the second part we have selected for 15 crore funding. Please remember, this is full grant. If you are failing, we don't have to worry about it. That is diabetic retinopathy, which I will be telling in the afternoon briefly, after this talk. Now, MedGenome, which I will be talking about. Then Sipwise Beverages, that's actually not our company because we have developed all their products mainly for functional drinks, nutraceutical, functional drinks. And Genome Life Sciences Private Limited, which we are starting now. So now we can go for probably about 15-20 minutes I can finish. This was the main talk, but now I shifted to the startup. So, yeah. Okay, before starting, now what I will be doing is that, using a technology, how a product is developed, how we have commercialized, and you will get some idea. Probably after some time, I'm very sure you will be also using, because many of the places people started using. Do you want a break or something?
20 minutes, okay.
Yeah.
After that, we can have a break.
Yeah. Okay, so now I will tell about how this product is developed. Development of magnetic nanoparticle based technologies for biological and biomedical applications. By the way, you have a nanotechnology department here? No. Are you studying about nanotechnology? No. Have you studied during the pharmaceutical nanoemulsifications, microemulsion, nanoemulsions, those type of things? Okay. So something.
It is in the infancy stage actually. Mainly the PG students, they are focusing on this nano-emulsions, nanotechnology based development sector. And for the undergraduates and diploma, they have only the basic thing, what is nanotechnology and delivery system.
So this is one of that. This magnetic nanoparticle can be used for various things. Right now, what we have done is that mainly connected to research and diagnostic purpose. Now, this also can be used for drug delivery, but nobody has successfully done that because of that complexity to introduce, because that is going to be an interventional thing, isn't it? So we thought that we will not do that at this point. What we will do, the easiest thing, low hanging fruit. That means nanoparticle for certain applications. Now we have entered into diagnostic market, as I mentioned, for the COVID things and many other things, and very interesting product we have developed, and it's quite easy to understand. So I'm not going to explain too much, but then you can ask questions. Oh, by the way, this is in 2010. You know who is sitting there? This is me. So I was invited by him to give a talk on nanoparticle, magnetic nanoparticle, and there were 2,000 people who were there. I was invited. About a 15 minutes talk, and that was quite interesting. So actually in Gujarat, subsequent to that, a department itself, they have started, and lot of grants they started giving. So after that, I was also there for some time during that. Then subsequently, I was invited 3 continuous years to give talks there. So this is all about our company. One of the most important thing I want to see is that, one is the product lines. See, we have multiple collaborations worldwide, universities. As I mentioned, this is the single company which everything done in a university initially. There is about 6-7 PhD students, their work is translated. And everything what we have done, there is a patent or there is a publication. I don't think you will be able to see a small company publishes 36 publications, and some of these things is extremely highly cited papers, which is very rare. So what I want to tell, the reason is that very scientific products are only we are developing. And because it's the scientific products, you can always publish. And definitely patents are required. These are some of the highlights. One of the first companies in India working in nanotechnology, innovative and first-in-class product portfolio, cost-effective and environment-friendly. Now we have 6+ granted patents, 10 applications and 35 highly cited publications. Over 35 million MAC genomes COVID-19 testing kits sold in India and Middle East during the pandemic. Now we have introducing those products in the US also. Do you know that Startup India, if you have a startup, do register to Startup India. A lot of advantages are there. So we have multiple certifications are there. We have DSIR approved, and we have got several awards during the last 4 or 5 years. Now, do you know what is the size of a nanoparticle? Yeah, it could be like 1 nanometers. It can be start from colloidal to 1 nanometers to 1000 roughly. It is extremely small, isn't it? How it is made? Magnetic nanoparticles quite easy to make. There are various type of nanoparticles are there. Magnetic nanoparticle, that is basically paramagnetic. That means a lone electron is there. Because of paramagnetic, it is magnetizable. Magnetic susceptibility and magnetic retentivity is magnetically susceptible. Using an external magnet, it attracts. That is what you are seeing over here. So whatever the particle, what we are making is about 10 to 12 nanometers. So how it is made is that ferrous and ferric iron under alkaline condition at about 80 degree, you can also make. Quite easy to make that one. And that is what we are using. Now, yeah, this already. So I will just briefly tell about the product what we have developed and the science behind that. What is the importance of the product what we developed is that these are naked particles. Magnetic nanoparticle are Fe3O4. You just remember, think about it. Normally, many people are using that, but they are coating this nanoparticle. Worldwide, anything what you are getting, only coated particle. Coated particle because it is very easy for any ligand to bind to that, any of the things. Even DNA extraction to be done, they coat it with something which attracts DNA. That is not what we are doing. We are using naked particle. There are various advantages are there because magnetic susceptibility is high. That is one thing. Particle size are low. That means surface area is high. So these are some of the major reasons what we are using. But imagine if you have to extract DNA 100% pure from thousands of other products, it is not easy if no specificity is there. So that is the technology what we have developed, which I will explain to you how we have done. Then DNA extraction, RNA extraction. You know what is the difference between DNA and RNA? One is single stranded, the other one is double stranded. Okay. Now if we are taking DNA, only DNA should be there. This single stranded one should not come. The same way, the same nanoparticle we are using for extraction of protein also. So how protein is extracted without DNA or RNA? Then we have also developed sample storage. For example, now it is not required that if you want to do the next generation sequencing of your genome or your RNA sequencing, because blood is not necessary, you can take saliva, you can take your buccal cells, in fact anything and everything, because you know gut microbiome is a big research is going on. It has been implicated that your gut, which contains millions of different organisms, forget about gut, your skin contains the number of organisms, bacteria, virus, yeast, which is much higher than your cells. Skin contains everywhere, your eye, nose, throat, everywhere microorganisms, and the maximum is in your gut. So, and saliva you can do your sequencing, your genomic sequencing. So that we have the sample storage device for saliva as well as fecal matter. Then COVID-19 detection kits. Do you know about immobilized enzymes? Immobilization technology, are you learning here? So there are various matrices you can immobilize, ligands, enzymes, proteins, whatever you want. There are various applications are there. So one of that we have done is that, using nanoparticle. Have you heard something called protein A? Protein A, protein G, protein L, antibody extraction. You're not, okay. So, ELISA, okay. Yeah, ELISA is a slightly different technology where like the multiple types, sandwich ELISA, competitive ELISA. So, for example, ELISA needs antibody, isn't it? So antibody invariably pure will be very fine. So in order to purify it is not easy because it is a protein with another hundreds of protein. So how to extract that protein alone? So that is what immobilized affinity ligands, which we have developed, protein A, protein G, the specific, the protein of interest, which is in this case antibody, you can develop that one. Then express pure, size selection and purification kits. This is one of the most important thing I feel we have developed. There is only one company in the world called Ampere. Unless how next generation sequencing is done, I can't explain that one, but I will just briefly tell. In next generation sequencing, have you heard a platform called Illumina platform? Illumina is an equipment that is what is sequencing your DNA, and the DNA is only small quantity, very minute micrograms will be required. But DNA can be 1,000, 10,000, 100,000. That will not work. What you have to do is that you have to break the DNA, extract it, break it, then once it is broken, you will get nucleotides of 100, 200, 400, 1,000 like that. You have to pick up only the 400 one. It is not an easy thing because all has got almost similar characteristics. That's the background and that's what we have developed called size selection. And that one, about 50 ml cost about $2,000. Can you imagine? Now we are selling that for about $700 stick. And we have just introduced in the US market. Um, maybe I will, as and when it comes, I will explain the science also. Now, Express DX, there's another group of product called kits for disease diagnostics. Right now, the disease diagnostic is like, of course, you can use ELISA or your biochemical methods. If you want to detect a virus, how will you do? If you want to do a virus, either virus has to be cultivated. Okay. The next is what? If you have an ELISA, probably you will be able to do. But if you want to do with an ELISA, definitely you should know what is the virus. For example, dengue, there are 4 types are there. It's not that easy to detect. Then what is the best way? Whatever it is, take a blood, if you sequence and the sequence is aligned with that particular virus, then you will be able to tell immediately, okay, this is the viral disease. Now what we have done introducing Express DNA simultaneously. For example, fever. If you are getting fever, you don't know whether it could be dengue, malaria, or hepatitis A, B, C, HIV, all those things can be possible. Probably in Kerala there is so many new viruses started coming, isn't it? So if this viral sequence is known, you will be able to, within minutes or by sequencing, you will be able to do that one. So that is Express DX. What we are doing is that the entire nucleic acid can be extracted and immediately will be detected. It will come in the market very soon. Express Automac, which is an automatic equipment we have developed. 96 at one stretch, you will be able to do that. Then Express nanoparticles for various applications. If you want nanoparticles, iron nanoparticles, copper nanoparticles, silver, we will be able to give. We also introduce molecular biology because which is normally very difficult to get, extremely high pure molecular biology kits and reagents. Now let's go through little science. Product differentiation, commercial DNA extraction technologies in the market. Anybody has done DNA extraction here using silica column? No. But normally most labs it uses. We have found that about 10,000 labs in India uses DNA or RNA extraction for various reasons. It is, you might be knowing PCR, which is called downstream processing, isn't it? Either PCR or sequencing. So this is the first, and it was the one of the important technology using silica column. That means silica, SiO minus, to which the DNA can bind. There is a way of extraction, separation, etc. Then coated nanoparticle, this is available right now. Everyone uses this one. So Coagens, Coas, Symphony DNA kits, in vitrogens, Kingfisher kits, Promegas, Maxwell. So in which what they do, they coat nanoparticle. It could be a protein coated, or it could be other oligos coated, or it could be a carbohydrate coated, any of these things. But what we are using, bare magnetic nanoparticles, everyone asks how you can get specificity if we are not coating anything, because magnetic nanoparticle. Now if you see magnetic nanoparticle, what is outside? There is something called chemisorbed hydroxyl group. A central charge is there, magnetic nanoparticle, and to which hydroxyl group can bind. So it is containing hydroxyl group. Do you know hydrophobic sites, hydrophilic sites? So if you see nanoparticle, this has got a hydrophobic site, hydrophilic site. A hydrophobic site, or if it is electrical is charged, that is electrostatic interaction, a molecule which is charged can bind to a charged molecule. Positive can bind negative, this thing. And do you know what is hydrophobic interaction? What is the interaction between oil and water? If you mix and shake, it will become an emulsion because on one tail that is carboxylase, COOH is there. So what will happen? That part will interact with the hydroxyl group, but then it will become a film. Now, but to an oil, let's say benzene you are adding. What will happen? That will mix because both are highly hydrophobic. A hydrophobic and hydrophobic can react, hydrophilic and hydrophilic can react. So that is the technology what we have used. What we have done, for example, if you see that the cell extract, or in cell extract contains what? Carbohydrate, protein, lipid, amino acids, so many things will be there. If you put little acetone to that, you can start seeing some precipitation. That first precipitation happens is invariably amino acids. So what's happening? Only amino acid came out. All other things are within the solution. But if you going on increasing the acetone, what will happen? Many things will start precipitating. This is basically the technology what we have used. There are two things we have done. One is the first precipitation. For example, DNA has to be precipitated preferentially. But that is an impossible task. Only DNA without protein. But you can develop a solution which is preferentially DNA alone can be precipitated. That is what we have done. The whole technology is based on that. One is a preferential precipitation. Subsequent to that, this nanoparticle which will be in a other fluid. When it is combined together, only DNA but with some protein will be binding, and this protein is removed. So that is the technology what we have used. There is, as I mentioned, there is a tremendous advantages are there. That's what we have done. Okay. So unique product positioning which gives us high purity and recovery of extracted DNA, strong IP coverage, cost and time effectiveness, and compared to other technologies. Let me also tell you that if still someone is interested to work on nanoparticle based products, still tremendous opportunities there. All connected to this area. Like, don't go into drug delivery and other things because extraordinary complex. So don't do that. Instead of that, start with very simple. This is another thing what I want to tell is that, most of the time, very simple things will work. Do that. Actually, 2 days back, 2 months back, someone came to me, they want to do a startup. They have no idea. Then I told the simple things you start. And what I did was that I have connected them with in Kerala University Cliff, and we are giving an equipment, high throughput extraction. I told so many people want to do the DNA extraction now, large quantity, microbial extraction, sand, microbial extraction from sand or from plant. So they are setting up a facility like that. Along with that one, what will happen? We will sell our product to them. But of course, we are giving an equipment to them, and probably they will start coming. So two ladies, women, girls. So one is PhD, the other one has a master's in agricultural thing. So they are going, training in our place. What I wanted to tell is that the model what I suggested, what they have also selected is a risk-free. They are not going to lose in this one. How much they are going to gain? Because hardly any money they have to spend initially. The moment they started selling, once they start using that one, they will start getting the money. So I just wanted to tell that. So this is the technology. Will just go very quickly. My 20 minutes are over. So express DNA column-based extraction mechanism. This is the column-based DNA extraction method. So the sample preparation and lysis, DNA binding to the column, washing the column, and DNA elution. As I mentioned, the silica is there, and to this DNA will be binding. Now, this is our method. This is column-based DNA extraction, express DNA, sample preparation and lysis, DNA binding to the magnetic nanoparticle, washing to remove contaminants, DNA elution, and you will get a absolutely pure DNA and which is measured by 260, 280, and you should not have other bands also. So this is basically a column-based extraction technology. This is what exactly is that. So this is the silica column and chiotropic agent like NaCl. Here somewhere. Yeah, once the chiotropic agent, which is sodium chloride, calcium chloride, potassium chloride, then you can see that OH, that O will be removed, Na will be there, and is the sound coming from here? Is it here? I'll just keep it. Yeah. Okay, so this is basically the technology in the column technology. Now spin column based DNA extraction is another one method which people are using. So sample lysis, DNA binding, washing and elution. Now magnetic nanoparticle based DNA extraction technology, which I mentioned, very quick because it takes only 20-30 minutes. Advantage is what? In all the cases, other cases, you have to centrifuge. So in this case, there is no centrifugation using a magnet. Now, let me tell you, this individual extraction is almost gone. Everybody uses large number and high throughput extraction. We have also introduced like magnet at 12 samples, even 96 samples also can extract using magnets. This is the principle. You can see, the hydroxyl group H plus ion depends on the pH. Whether it is OH ion in the alkaline condition, H plus ion in the acidic condition, accordingly the structure changes. Then what you want to separate based on the charge of the nanoparticle, pure physics or pure chemistry. Okay? That Magnum Express DNA RNA kits. So these are some of the products. I just wanted to tell exactly the same technology what you have used, but the starting method is going to be different. Blood DNA isolation, dried blood spot, tissue cell line and DNA isolation kit, bacteria DNA, mycobacterium, which is very difficult, mycobacterium. So now we got the approval to sell mycobacterium for tuberculosis. Saliva DNA isolation kit. This saliva DNA extraction, we got about 1.25 crore from BRAC funding because during COVID time, they wanted to extract or detection of COVID virus from saliva instead of, nasopharyngeal, which many people consider not this thing. And what we have done is that 100 samples we have done and there is a 100% concordance, nasopharyngeal or from saliva. But now if suppose COVID was continuing, now we will not go for approval because we don't know whether COVID is going to come. Maybe another viral disease might come. But the thing is that at that time when we went there for the approval to take it so that everyone can use saliva, they told another 2,000 samples we have to take, various places and come out with the data, then they can give the approval, then we will be able to sell the product. So by that time COVID also finished. Probably if it was not finished, we would have continued that. The same way DNA, of course in the case of COVID, it is RNA. So viral RNA kit, bacterial cell line, saliva RNA, so isolation kit. So these are the product. This is not advertisement for product, but I wanted to tell the science behind it. I know that you are not going to use this. This is mainly used in research lab. But if you are going somewhere else and doing this, you can try ours. We will give free samples. Even now, if you for any reasons, if you want to use, be able to use, because you will realize that it's far quicker, very quick. So these are some other products what we are selling: molecular transport media, manual viral RNA extraction, automated viral RNA. So these are various different types of products which is available. These are the equipments as I mentioned, these are all came up during COVID time. This was not there, rapid extraction. So we also introduced our product during that time. This is, let's see. No, our product is not there. Maggenome Express Pure product line, which I mentioned that, Express Pure for extraction of a specific size of DNA. So probably I would suggest that, it is very important that you should learn, especially if you are in biotechnology, biopharma, probably if you are in pharmaceutics, pharmacology you might require. So it's better to just understand what are or at least it will be very useful in the future also. How these extractions, how the DNA sequencing, because that is going to be the technology probably 5 years from now. Many other things are going to go down. Everything will be automation and this DNA based diagnostics. Also for precision medicine. I don't know whether 5 years or 10 years, but it's going to be there. Yeah, this is the automated instrument which we have developed. Right now, see, the cheapest one is about 28 lakhs or 25 lakhs, Kingfish or something. So we are selling about 8 to 10 lakhs. So this is Express DX product. Express DX means, as I mentioned, you will be able to extract the DNA or RNA simultaneously. You will be able to study using sequencing what disease or what virus is attacked or what bacteria. BAB is done and there is number of volunteers are taken, blood is taken, complete pharmacokinetic profile is to be done. Now the same thing has come for biologics. For example, antibody. But then antibody is injected how much? Probably micrograms only. This has to be detected. So this microgram detection is extremely difficult. So one of the things what you can do is that protein A, which will only extract the antibodies. So you can do that one. Protein A, protein G, or protein AG, etc. So this is the technology what we have used. This is a patented technology. What we have done is really a different technology for binding, whether it is proteins or other molecules surrounding the nanoparticle. So what we have done, when nanoparticle is embedded with protein, what will happen? It will bind. That is by electrostatic interaction. Then subsequent to that, what we will do is that, we will cross-link with epichlorohydrin. The epichlorohydrin cross-linking is a very well-known technology. So that is what we have done. We have filed the patent. You can see the paper also and many applications you can use. But the technology is patented, but realistically others can't use this. So this is the TM image. Advantages of this strategy. These are the advantages. So these are some nanoparticles what we have making, and if anybody wants to use any of these nanoparticles, would be happy to give this new nanoparticle. Then also coated nanoparticles. These are some other products what we have developed mainly for molecular biology applications. So these are some of our customers. So forget about this advertisement for the company, because that's not my idea. Without telling that, I can't tell. But then the idea was only to tell about the science behind. What simply I wanted to tell is that a simple technology, now we have converted it as an industry. Now probably our idea is that in 5 years bring this product worldwide. Now in India and now started in the US market. So probably other places also. The other things, other takeaway is that mainly the entire work is done in university and also PhD students. Make sure that you can also have translational work during the PhD. Now I have started these type of things. I realized what exactly when I was doing in India or US or UK, I have no idea why I did those type of research. But but when you are doing kind of research, make sure that at least some kind of translational element is there. I just also wanted to tell one thing. We also have a PhD program which is in-house in the company, which is approved by two different universities. One is Australian University, Swinburne University. Another one is Charotar University of Science and Technology in Gujarat. Students can be in our place, and apart from the scholarship that you are getting, but it is compulsory, you have to pass UGC CSIR. If you pass, you will get that scholarship, plus we will give 25,000 additionally, plus up to 10 lakhs in a year we will spend as the expenses, which normally you can't get, but it is not easy to get also into that. And we need a lot of people for work. The only thing is that that you have to just go through simple interview process. If you pass, you will get a job in our place. Thank you very much, and you can ask question for maybe 5 minutes. Let me see what type of questions are coming. After this, the other product, probably which you might be knowing better, how we have developed two fab molecule. One is for macular degeneration, another one is diabetic retinopathy. Thank you. Any questions?
Any questions?
Either you understood everything.
You can have a short break.
Yeah.
Even you can ask questions during the tea hour also.
If no questions,
Any
thank you.
questions?
So,
Any doubts?
Any biosensor?
no, we are not using any biosensor, but someone is going to come to do some microfluidics methodology. So we are not doing anything. You are telling about nanoparticle, isn't it?
Involve
Sorry?
any bio?
No, we are not doing any.
Any other doubts?
In fact, what I wanted to communicate to you, he has communicated. That's what I feel, because before starting I was telling him. Hello. No need. No, whatever I was expecting to transform to the students, he has well expressed. So I want you people to take up that and move forward. In fact, he has given the basic, that is how to develop a nanotechnology which can be used for various diagnostic purpose. So since we are pharmacy students, we are focusing on drug delivery. So why can't you think of a diagnostic tool which can be prepared with this, at least for the early detection of cancer? I think this talk may motivate you to lead.
Excite some people.
Thank you, sir, for sharing your knowledge with us.
Thank you.
1 minute, sir.
I would like to call Professor Agil Hari to present certificate to Dr. C.N. Ramson. Thank you, sir. I would like to call Dr. S. Kadirwell, Professor HOD, Department of Pharmaceutical Analysis, National College of Pharmacy, to present certificate to Professor Agil Hari.
take that tea, come back, because it is for you people. Don't think that you are missing something. If you miss, it is missed forever. That's all. So be here after the tea break.
Session will start at 11:45. We'll take a short break of 15 minutes.
KMCT.
Once again, I welcome you all back to our scientific session. Now it's time to step into the second session of the day titled Discovery and Development of Anti-VEGF Tab for Wet Macular Degeneration and Diabetic Retinopathy by our former speaker, Dr. C.N. Ramchand. Before we kickstart the session, let me take this opportunity to introduce the chairperson of the session, Dr. Kiran S.S., Professor, Department of Pharmacy Practice, College of Pharmaceutical Science, Government Medical College, Pariyaram, Kannur. He is an eminent personality with over 2 decades of experience in academia, pharmacy, research, and publications. Over the years, he appeared as a speaker or a resource person in various national and international conferences. Also, he accounts various articles published in national and international journals. He has been awarded with research grant from Kerala State Council for Sciences, Technology and Environment, Thiruvananthapuram. Also, PharmaBridge Training Fellowship, University of Sydney, Australia from PharmaBridge FIP in 2018. Dr. Kiran SS is also an active member of editorial boards of various journals such as American Journal of Medical Case Reports, World Journal of Pharmaceutical Research, etc. He is also an active life member of Indian Pharmaceutical Association, Indian Society of Pharmacoepidemiology, etc. With great honor, I welcome you, sir, to chair the session. Sir, please.
Good morning to all. So I think you will already Sarah's given a talk on previously with the nanoparticles. Now the next topic is basically on the diabetic retinopathy and wet AMD diseases. So we know the diabetic now become the one of the most metabolic disorder emerging, and epidemiologically it is increasing in day by day, because one of the major complication of diabetic is retinopathy and the microvascular complications, and So, sir, this is a new molecules are coming to the market. So we need for the management of diabetic and diabetic retinopathies and other conditions. We need a new technologies. So this is a new molecule is coming up. We can hear the talk on a discovery and development of synthetic anti-vascular endothelial growth factor, that is FAG, antigen binding fragment for treating wet AMD and diabetic retinopathy. Yes, already there is a brief introduction as given by the previous chair, Mr. Agil sir. Dr. C. N. Ramchand, I go through the his sir CV. It's taken 10 minutes to explain his CV. That has so much experienced speaker. Is a very experienced researcher, academicians, administrator, and he have a lot of publications, patents, books. I have seen lot of. He is an adjunct faculty for the different universities. He is guiding PhD students. So it's very happy to learn from him and his experiences. So we can hear at his talk and welcoming Dr. C. N. Ramson for the next talk.
So I think about 10%, no, most of the people have come back, isn't it? So we are going to have a 180-degree difference compared to what I have given earlier. So this is how we have developed very first time in India a novel molecule. It's actually a biologics molecule, biologics. So you know the difference. Let me ask some questions. At least you will. If you are not answering, that is fine. I myself will answer. So do you know what is the difference between an NCE and biologics? No. Okay. So NCE is new chemical entity, small molecule, which probably those who are in pharmaceutical chemistry, pharmaceuticals will be knowing. So like our paracetamol, brufen, those are called NCEs. And if a new molecule is being developed, it is called NCE. Otherwise, it will become generic molecule. The other part, the other type of molecule is called biologics. You might have heard about biosimilar. No. Biosimilar means if a novel biologics is introduced, after some time, it will become a generic. It is called biosimilar. The difference is what? The first one, NC, is a synthetic molecule. The second one is a protein molecule. Do you know insulin? Yeah. So insulin is a biologic. But then that was introduced 50, 60 years back. After several years, there was no biologic molecule. Then right now, so many biologic molecules are coming. The way which it is introduced, it is acting, everything is different. The way which is metabolized compared to an NC is different. And I have only not much time, so let me do one thing. Do not worry too much about this background or other information. I will go on talking so that you will be able to understand something. So, but before starting that, let me introduce drug discovery. Without introducing, because if you knew about drug discovery, it would have been good. Because let me tell you about drug discovery. Again, I will ask questions. Do you know how many human diseases are there? Anyone can tell a rough idea? Okay. As of now, it has been calculated that about 35,000 human diseases are there. And how many base molecules, how many drugs are there? As of today. Drug discovery started only 40, 50 years back. 100 years back, one of the earliest drugs have come, like aspirin or artemisinin, those type of molecules. Then many of these molecules have developed through serendipity, means accidental. Then about 40, 50 years back, rational drug discovery has come. In rational drug discovery, serendipity will not work. You need to know what is your target, where it is going and binding. the complete structure of the molecule, how it is metabolized, and how it is excreted. So much is there. Now, another question. Do you know how many years it takes for developing a drug molecule? More than 10 years. I accept that. Roughly about 12 to 14 years takes. Now, when I tell about this, many people tell how this vaccine has been done in 1.5 years. That's altogether a different thing. That if you want after this one, I can explain to you the difference between developing a vaccine and developing especially a vaccine. If you know about the virus, that's not very difficult. It is going to be definitely a successful thing, not like drug discovery. Now, another question, how much it costs to develop a drug? Any idea? Sorry? No, it is about $2 billion, which is about 14,000 crore. How many scientists are normally involved in drug discovery, the entire end-to-end process, discovering part? There are two different types of discoveries there. One is target discovery, the other one is molecule discovery. Then it goes through a series of development process after discovery and finally ending up with clinical trial. Altogether, 12 to 14 years, cost is 2 billion. And I told about 35,000 human diseases are there. And base molecule. So can you tell a name of one of the molecules what is available now? Anyone tell? Means drug. One drug's name. Pharmaceutical people, isn't it? Any one drug's name. Why? So I have to much more simplify my talk then. Does paracetamol is a drug? Yeah, paracetamol is a drug. Crocin? Crocin is a formulation. That is also drug. Paracetamol is that. So the question is that how many such basic drugs are there? Basic drugs means structurally unique and there is only 400 plus. There is a category of drug called Me Too drugs. You know what is Me Too drugs? You might have heard that word. Pharmaceutical people. Me Too drugs? No. See, when a drug, first generation, second generation, third generation, have you heard chlorpheniramine maleate? What is that? It is an antihistaminic, isn't it? Very sedative. Then, if already it is antihistaminic, there are series of other products have come, which is structure is somewhat similar. Similarities are there. What they were trying to do is that quick action and less side effect. These are called Me Too drugs. That means there is structural, because you are developing a structural analog and developing the product. Like that, about 2,000 drugs are there. For example, if you see pain, and for example, if fever and pain, there is only paracetamol is there. If you see about brufen and like that, few other molecules, if it is chlorpheniramine, like antihistaminic, there is about 7 or 8 different types are there. So that, and if it is for asthma, salmeterol, there is about few series are there. So basically, there is only, excuse me, backside. There is only 400 plus drugs are there. And what's happening is that, there is only few drugs have been coming out, this small molecule NCE, in the last few years. As I mentioned, last 40 years started. In 40 years, the peak of the drug discovery, about 40-50 drugs started coming. In the last few years, only 7 or 8 small molecules have come. Now it is expected in another 10 years, no more small molecule, because it has become very difficult. Why very difficult? Because normally to develop a molecule, 10,000 drugs has to be synthesized, roughly, because I was involved in developing those type of molecules. All these drugs will have activity, structural similar. But what will happen during the development process? Either it will not be absorbed or very rapidly metabolized because of cytochrome P450, or there will be toxicity. Eventually one molecule comes out as a drug. Now what is happening? This is one of the reasons no Indian companies, when I came from UK, that's what I started doing in Sun Pharma. But now not a single Indian company involved in developing any novel molecule. Doesn't matter whether it is NCE or biologics, any of these molecules. The reason is that because of complexity. Okay. So this is one part. I just told you about the complexity of drug discovery or biologic discovery. Another question, how many genes you have? Humans. This is a well-known question. Many interviews, if you go, you will get it. Connected to this, there can be a lot of questions. There is 30,000, roughly 25 to 30,000 genes are there. How many proteins? It is expected that we have about 200,000 different types of proteins are there. Because 30,000 genes is expecting 30,000 proteins, isn't it? Because post-translational changes like that, various genes, about 200,000 proteins are there. Anyway, out of these proteins, do you know what is a drug target? Okay. Yeah. So invariably the drug targets are functional proteins. What are functional proteins? Receptor, enzyme, then gene is not. The basically, okay, let me finish this one. So the protein targets are, it has to be a functional protein only, invariably. Okay, I'm not telling that there are some cases there is structural proteins too. Functional protein, enzyme, receptor, ionic channel, transduction protein, transport proteins. These are the ones. But most of the drugs, 50-55% is based on receptors, and few are enzymes, few are ionic channel, very rarely on transport proteins and other things. And it is expected that this 35,000 diseases, you need to have about 2,000 drug target proteins. But we have identified only 200 plus such proteins. That means still many more diseases we have to unravel. We need to identify the mechanism. And out of this 35,000 diseases, about 22,000 are rare diseases. Okay. What is rare disease? In the US it is explained, if suppose over there it is affected to less than 200,000 people in the US, then it comes under rare disease. Now the problem is that in rare disease, no companies are very much interested because it is very difficult to make money out of that. Anyway, these are some of the background, and in this background that we have to develop this molecule. So the story of that, how we have developed, how we are reaching to the phase 1. Right now we are going for the US. So this is what I am going to explain. Now if you have any questions about drug discovery, see, actually I take workshop on drug discovery. That's a 2-day workshop, and which I mentioned to you in 5 minutes. So if you have any questions, you can ask me. The question is that when Me Too drugs, that means analoging a drug, there is a patent issue is there. Okay, when anybody is starting a drug discovery program, developing a small molecule, the first thing what you check is that patent issue. If this can't be patented, somebody already has patented, the entire work will go futile, meaningless. So the first thing you have to do is that. The question is, when you are developing Me Too drug, that means You already have, advantages of developing a Me Too drug. You already know the target. You already know the mechanism. You already know the structural requirement. What is going to work. So when you are developing that Me Too drug, which means you are taking an existing drug and making out of that. But that drug has to be better than the existing one. That's what one of the drug I developed was in Sun Pharma, which failed, is on for antihistaminic. At phase 2 it failed. So that's the story again, one of the molecules, because we spent 3-4 years working on that. It was a Me Too drug. But when you are developing that, the first thing what you have to do is that what are the structures the original company have patented. The second thing is that whether there is a prior art is there. Does not matter whether it is patented or not. Prior art through publications, anywhere it is revealed. Then if you develop that molecule and found that it is active, then you will, because you can't patent that. That means it's already a prior art. Anybody can anywhere do that. So what you have to do is that when we are doing even analoguing, means existing structure, you are improving, changing. The first thing what you are required to do is that what is the problem with the existing drug. For example, when I was developing a drug, antihistaminic, what we wanted is that, all the antihistaminics have one problem. What is that? Sedation. Very good. I got one answer. Every antihistaminic has got sedation problem. Now, a non-sedative antihistaminic people have been trying to do. Why there is a sedation? There are two possibilities. One is it is going to the brain, and probably it is going to other receptors, for example, GABA or dopamine or serotonin. Probably some of these receptors it might be binding, then you can get sedation. The same, there is another theory, and now it is kind of proven that in antihistaminic H1, which is present in the brain, has got a sedative effect. That means so what you have to do is that a molecular structure in such a way that you can take it, it will go, but it will not have access. Blood-brain barrier should be there. That's what we have done. For a molecule to be having blood-brain barrier, there are structural requirements are there. Based on that, that is what we were doing. And the thing is that we have gone through the entire structures. It takes quite some time to make sure that this structure is not patent. And when we developed that one, we got the patent. It is filed also. So that is what we will have to look into. Anyway, so another thing what you have to remember is that in the whole world, only 7 countries have produced drugs. Most countries, not even European countries, because of the cost reason. And most importantly, any drug discovery, the first requirements are mechanism. This is without knowing that what drug you can develop. Drug discovery, the mechanism or the target discovery is one of the most complex things in the history. If I am asked to find or send a rocket to moon, I don't know any rocket technology, or find out a target for a pancreatic cancer, let's say. Everyone knows that pancreatic cancer, what is it? So what I wanted to tell, it's okay. Forgot. Yeah, we are talking about pancreatic cancer and the target identification. So target identification is one of the most complex things, and no company will do that, because even if you identify a target, you can't patent. It is not your proprietary. That is one reason, because you can't patent an existing protein, and you can't tell that this is the target identified, you can't find a drug against that. It will not work. That is one reason. That's not the main reason. The main reason is that you have no idea you will come out with the target or not. So who is doing all these things? These are the things which is done in the universities worldwide. But in order to do that target, you need to study the mechanism. That's why you might not be knowing that, for example, let's say cancer, certain cancer people will be doing certain things. One is mRNA expression studies, what are the SNPs, other is what are the proteins which is upregulated. These are the things, but these are extremely rare things in India too. But in US, Europe, this is one of the major things. And if you see in the UK, the maximum amount of money they are getting from these type of things from charities. For example, Imperial Cancer Research campaigns. Like they're about 10 very big, each one having several $1 billion. They fund worldwide this for these type of novel mechanism, targets, identification. How many cancers are there? There are more than 3,000 cancers are there. Only now, many of the target proteins, which is the surface antigen which comes out in cancer, is identifying. If you identify that, you can develop a vaccine, you can develop a drug against that, you can develop an antibody. So this is coming out, but probably in few years, many drugs and mechanism will be identified. You might have heard about, breast cancer. So there is various types. What is that? Herceptin negative, Herceptin positive, triple negative. Please go and read that one. This is the result of this drugs and target identification and pharmacogenomic study. So these are the things. Now, so there are 2,000 plus cancers are there, and there is 1,000 plus cardiovascular diseases. For example, blood pressure is considered to be one of the part of the cardiovascular disease. Realistically, many of the cardiovascular diseases, do you know that cholesterol was implicated in cardiovascular disease, isn't it? Is it now? Cholesterol is not connected to cardiovascular disease. There are only few things has been implicated. One is type 2 diabetes. There is a correlation between type 2 diabetes and cardiovascular death. So many other things, even triglycerides, So realistically, and even now what is happened, people are questioning, there is no properly, the results have come, whether your bypass is right or wrong. There is an argument that, it is not required to do bypass, because automatically if you have this thing, but I don't believe that. I still believe if you have a block, it is better to do an interventional this thing or like a bypass or something. Anyway, what I wanted to tell is that one is the drug, this thing, but even for cardiovascular disease, realistically no drugs are there. Because a drug means it should completely cure, like an antibiotic. But on the other hand, we are extremely successful in developing antibiotics, except in few cases. Vaccine, including bacterial, yeast, and viral vaccines are start coming. So the entire this 400 or 500 things are only for few diseases, Still for cancer, cardiovascular disease, and there is one, this thing, neurological disease. You think Alzheimer's disease, 4 molecules introduced against GABA secretase, against cholinergic acetylcholinesterase, NMDA, everything withdrew. So in the central nervous system, out of this, about 11,000 diseases are expected, including major and rare diseases. There is no drugs. Schizophrenia, I worked on schizophrenia, depression, mania, all those things. No one knows the mechanism of schizophrenia. Dopamine receptor, D1, D2, D3, now D4 also has come. In our body, there are 20 billion interactions are possible, including your DNA, RNA, protein, amino acid, and various types of small molecules. Anything can go and interact with anywhere. That is why this complexity, especially metabolic pathway. That's why all these, many of this drug discovery either failing or very difficult. So I just wanted to tell one of such background how we have developed synthetic anti-VEGF. VEGF is vascular endothelial growth factor. There are various type of VEGFs are there. So there is 121, 165, which is upregulated in the eye. Okay, vascular endothelial growth factor, vasculature. That means upregulating the vasculature. Anti-VEGF, that means something against VEGF, growing VEGF. That is what we have done. Anti means it has to be an antibody. Antigen binding fragment for treating wet AMD. So this VEGF, anti-VEGF, go and bind to antigen binding fragment for treating wet AMD, wet age-related macular dystrophy and diabetic retinopathy. So we have developed two different types of molecules. Now you know antibody. So this is the part of the antibody what we have developed. I will just explain to you. So this is our company profile. Development of new biologics and biosuperior for treatment of wet AMD and diabetic retinopathy. Oh, so this is already I have, explained to you in the last thing. So this is the company, Therajan Biologics Private Limited, Chennai-based company, focused on the development of novel biosuperior biologics and contractual biosimilar projects, highly experienced, capable management and scientific team. Another interesting thing, these are all developed by about 25 people. You know, as I mentioned, the greatest difficulty what we are facing is getting people. And the technology what is required is right from fast display. Then number 2 is the cloning, then expression. Then there is something called upstream. Then there is something called downstream. There is about 30 analytical techniques are there. And please remember, this is all new. So you can't get any kits also anywhere, even for that. Everything has to be in-house developed. So in this background, so what we are telling is that this 25 people, what we have done is that train them very well. And they should enjoy what they are doing. So one thing I realize that if people enjoy in work, they will stay on. Then everything becomes secondary. Okay? So that is one of the primary things what used to do, like, train. We used to have a lot of classes. We used to call people, and any conferences we have. That's why some of the conference, so they will do like this, because altogether we have about 150, 200 people are there. But this molecule development thing. Highly experienced, capable management and scientific team, effective yet cost efficient R&D team based in India, utilizing the strength and expertise in biologics development, successful prior development of biologics and regulatory approvals, 2 novel biologic molecules for wet AMD and diabetic retinopathy, ready to go for phase 1. It is actually we have submitted in the US. Now about this is about 30 million people are affected by macular degeneration, wet AMD. This is what you can see. Normally this is affected by 50, 55 plus. But the important is that imagine you are seeing, you can see, suddenly you are losing the vision. You feel like that right hand side. You won't be able to see anything. So, 30 million, roughly about 200 plus million people are, there is something called dry AMD. Have you heard of dry AMD? AMD, age-related macular dystrophy. It's like, you feel dryness and, itching, irritation. Now, if you get that disease, 15% will become wet AMD. This is a genetic abnormality. But who is going to get this wet AMD? That you don't know. That's why artificial intelligence have come. Now, anybody's retina can be scanned and probably will be able to predict. Are you going to get this disease or not? So this is about the wet AMD. And you can see the right hand side. You see the right hand side in wet AMD. I will explain first, then as and when the slides comes, I will just pass through. In wet AMD, this neovascularization, more vasculature. Isn't it? In order to get neovascularization, you need to have a lot of VEGF. So that produces. What will happen in the retina, in that side, that blood vessels start growing. Okay? Initially you won't know anything. Suddenly one day what will happen? This blood vessel breaks. Then in the eye, the blood will be oozing out, then you won't be able to see anything. That is what is happening. So what is the way out? If you know the genes, SNP, specific mutations, then you can do the gene therapy. By the way, there is one gene therapy has just come out for eye disease called retinitis pigmentosa. So it's the gene therapy which is there in US. We are also trying to get into that. So then this breaks. The only way is that, either it should not break, otherwise this VEGF has to be removed, otherwise it should not have the growth thing. Now, key problems being addressed. Now, what we have done, the background is that there is already an existing molecule called Lucentis. Lucentis is to be injected in the eye. Lucentis is like a Fab molecule. It's a protein molecule. It's produced by Genentech. You know what is the cost of injection? Right now it is $2,200 per injection, and in a year you need to have 8 injections to 12 injections. Imagine, so about $25,000-$30,000. This not now, earlier. Earlier it was much higher. Now it is $2,000. In India it is now about 25,000 rupees per injection. But this is one thing, and apart from other expenses are there. But that is not all now. There is a lot of people are refractory. The other one is that, after injection, about a large number, again, after 3 injections that, they come back. So overall efficacy of wet AMD with Lucentis is about 45%. That means 55% it is effective. So what we looked is that we have an opportunity there. One is that whether can we take care of the remaining 55, or can we develop a molecule which probably can be effective in at least more than that. That is one thing. We were sure that we will be able to develop a molecule which is cheaper than this, which is turned out to be far, far cheaper when we calculated. The other thing is that, Lucentis was originally introduced 500 microgram injection. Then many people started getting inflammatory conditions. Then they reduced 300 micrograms. Still, it is painful and so many other problems are there. So we knew that one possibility is that we can significantly reduce the dose, but by increasing the affinity. The other thing is that it should be having a better pharmacokinetics. So these are some of the problems are there already to solve. So that is what. So when you are developing this molecule, that is one part. The second thing is that this whole problem has to be developed. So that is what we have done. Yeah, as I mentioned, expensive treatment, highly temperature sensitive with minimal stability, limiting global distribution. Do you know one interesting thing? This vaccines and everywhere, there is cold chain management. Do you know cold chain management? Cold chain management means even chickens are vaccinated on the 7th day. So by the time that before ending that vaccination, that because of cold chain management, the vaccine will get denatured. Okay. So we have developed the formulation which is temperature sensitive, means not sensitive, in the sense at 37 degree also it is working. So this is accidentally came. Why it is like that we don't know even now. But we have some reasons to this thing. We have filed a patent also. So normally these molecules are highly temperature sensitive. Existing anti-VEGF treatments require injections up to 8 to 12. What is the time? 12:30. So I will have complete in 15 minutes. So existing anti-VEGF treatments require injections up to 8 to 12 times annually. Expensive development costs with the prolonged timelines. So this is the molecule. So you can see that. So what you are rotating in the center is the this is the actual molecule, and the other side is the antibody. So the antibody can bind from both the sides. So there is a light chain and heavy chain is there. So this is mentioning about the two different molecules. FAB 201, which is what wet AMD. The other one is for diabetic retinopathy. So this is all about the brief about the molecule. Anti-VEGF expressed in microbial system. So many of these proteins can be expressed in any system, microbial, even in bacteria, even in yeast, any of these things. This do not require post-translational changes, because when there is a post-translational changes, you will have to use mammalian system. Developed using phage display technology. Have you heard of phage display technology? Phage, what is phage? Anyone can tell you. Phage, you would have heard. Nothing virus. Phage is virus. Because I can't explain that, the time will go. So, developed using phage display library with several rounds of affinity maturation for selection of clones with the highest binding affinity, followed by site-directed mutagenesis. So forget about all those things. What I want to tell you is that this particular antibody is developed using phage. Phage is virus. Just like plasmid, phage are there. Circular DNA, which is introduced in the virus, and this virus expresses the protein, and we will see which type of sequence expresses the best and the highest affinity. That's all. That is what then. So it's an excellent technology which is very recently developed, last 7-8 years. Now, antibody development, classically how it was done, you take the antigen and inject into animals. So no more it is allowed also. You have to do through phage display technology. There are a few other technology also is there. And this molecule is 48 kDa. What does that mean? What is the antibody size? The antibody size is about 148 kDa. You Y-shaped, isn't it? Out of that, part of that, where the antigen goes and binds, that is what we have done. That is 48 kDa. And it selectively binds human vascular endothelial growth factor, 165 and 121. There are at least about 20 different types of VEGFs are there, sequentially different, but these are all involved in vascular, but various places it is involved in upregulating, etc. So this is focused one which is upregulated in the eye. And cross-reactive with the mouse VEGF and rat VEGF. There is a reason we have developed like that in order to do the experiments. 5201 is comparison to Lucentis, current approved drug in the market, better affinity, about 10 times better affinity. This is what the success we wanted to make. Because we have done using phage display, we could do that. So that this product do not have to inject to 500 microgram. Maybe we can inject only 50 microgram. Better biological efficacy in VEGF-induced HUVEC cell proliferation assay. This is what the molecule. You might be knowing, or if you do not know what is VH or VL, etc. So the right hand side, what you are seeing, this is the entire antibody, this is the constant region, and this is the binding, where the antigen. What is CDR? Complementarity determining region. So the nucleotides present will translate and transcribe to the amino acids, and to which the paratops will go and bind, epitopes and paratops, where the antigen will bind. So if you see the previous slide, that which is rotating, that is what? So it binds to that specific area. So what we have done is this one. This is what cloned and expressed and developed. Now this is the process flowchart, how we have done. So fab discovery and optimization. The first part is discovering this fab molecule, which I mentioned we have used the fast display technology. So then what you are getting is that eventually you will get the sequence, nucleotide sequence. That nucleotide sequence will be put it into a plasmid and put it into bacteria. A particular bacterial species is there normally. Then upstream processing. Upstream means the fermentation process. Okay. So fermentation means you have to start from small scale into lab scale to things. So then downstream processing. Should I stop for a minute? So the upstream process means you have to do the fermentation lab scale, then you will have to scale it, and these fermenters are very, very expensive, anywhere between 1.5 crore onwards, that where the optimization. And the entire process of development, what I feel is that the purification process, which is called downstream processing, is the most important, because from bacteria produces about 20,000 protein, and this single protein you have to isolate. There is no other contamination. No contamination from the bacteria should be there. No other protein should be there. So then once that downstream, the protein is purified, it will immediately go for formulation. If you don't formulate, what will happen? The protein will get denatured. Now, interestingly, this particular protein stays only for 1 or 2 days. After it's very quickly this thing. So what we have to do, the moment it is purified, we will have to go for our own the formulation process. But please remember that all these things are done by everyone who knew nothing, any of this. So that itself was a challenge, teaching, training them. But then they all have become real experts, because it is impossible to develop a molecule. Even the biggest of the big company in India and many other places tried to develop this one. So this is the whole process in a simple way. except the last one which is going on, the approval process. Currently, we have filed in USFDA discovery phase. Then what you have to do is that you have to do a proof of concept, whether it is really working or not. So in proof of concept, one of the most important thing is that there should be an animal model. No companies will do any drug discovery unless there is an animal model is there. You have no idea, because at least reasonably they should be convinced that it is going to work. Because that every disease there is a models are there. For example, every cancer there is a model is there. Every cardiovascular disease there is a models are there. Every metabolic diseases there is a models are there. So without that it is impossible. Even for schizophrenia they have come out with some models. You know. Then after that the development stage. Then upstream, downstream formulation, bioanalytical, biochemical and in vivo. Then regulatory approvals, preclinical studies, CGMP. And one of the most important thing for a company like small company is the CGMP manufacturing. There are not many places. Big companies have their own, because they can't use. So one of the challenges what we faced is that, we wanted to do, I went to Lonza in Singapore. They quoted $12.5 million. Then we went to Syngene, Biocon. Then there are 2-3 companies everywhere between 3.5 million to 4.5 million in India, but the time taken also is 3 to 4 years. Because if you want to do the CGMP, you might be knowing what is GLP, GMP, GCP and everything. So GMP manufacture is altogether very different, because we have to train them, every analytical procedure from the beginning it has to be done. Finally, what was done, we have collaborated with a company above us, one of our friends, and 3 months we could do that. So this is the best part if you have a very good network is there. Then finally that, the preclinical and the CGMP stage. After that, IND filing. What is IND? Right, investigational new drug. Now what I have shown here is that the US. In India, there is about 23 approvals are required, the molecule. And one of the complex approval process in India, and let me tell you, I've gone many times. We are the first one, this molecule get the approval, what is called C3, for a novel molecule. Because they were also not knowing how to deal with the novel molecule, because nobody has filed novel molecule, novel biology. Finally, we got the other molecule, wet AMD, we just got 3 days back. The C6, what is called. Now we are allowed to go for the next stage. So this is, I'm not going to explain. Basically, phage display technology. You can see in the center phage mid. And this phage mid is utilized. And this is the process we are doing. This is a phage, which is a virus. And the whole sequence is developed through that. You can see this is EC50. See the picomolar. See, another thing what you have to remember is that any molecule has to be successful, has to be in picomolar range. Femtomolar, picomolar. Many times even nanomolar will be failing, because what has happened is that it has to be working at extreme low concentration, which is just getting diluted. So this is 175. See how better the molecule is. This is about, you might be knowing molecular cloning, isn't it? You might have studied. This is the 2 different molecules, where one is the up one is Lucentis, the down one is our molecule. The colored one is the CDR. Now it is compulsory, we can't repeat that CDRs. That is a patent. That patent, this thing, we can't use their sequence. That's the most important thing. These are all amino acids. So that was the most important thing. That's why we have done several phage display screening to develop that one. Okay. So, I'll just try to, it's a very complex slide, so do not worry. One of the things when we went to the regulator to prove that this is a new molecule, they want to put question that is not regulatory's question normally. They don't have to tell. What they were asking is that where this VEGF, the Fab molecule binds, the CDRs bind to the VEGF molecule. Now you have seen there are many amino acids it is binding. What we had to do is that we had to mutate the VEGF molecule and show them that it is not binding. What we simply told is that after mutating the affinity is so low, so there is no binding between this thing, which they believe this is what it is showing. Master cell bank and working cell bank. Master cell bank means once we develop this one, we need to have master cell bank working. There is something called research cell bank. From research, master cell bank will be made. Now for years and years, that master cell bank only can be used. So there are so many reagents are also there. The complexity is unbelievable. So outline of upstream process, this is what we have done. You can see, because we like to show 5 different, in this thing, purification, it is identical. Downstream processing, then these are various analytical assays. As I mentioned, about 25, 23. Very complex assays are there. ELISA using quantification, quantification for affinity. Affinity means how tightly the antigen and antibody binding. So SPR, surface plasmon resonance. Plasmon, surface plasmon. So another technique mainly for this affinity. Then VEGF induced the STRT-RP1 proliferation assay, because it's compulsory that one in vivo assay has to be in ex vivo assay, cell-based assay has to be there, and throughout the process when it is going for manufacturing also. Then the product characterization, PI, intact mass, disulfide bond, PMF, amino acid sequencing, circular dichroism analysis, in-process related impurity, host cell protein. Host cell protein means none of the host cell, which is bacterial protein, should not be there in the final product. How it is done? 20,000 protein. What we do is that these are the standard protocol. You have to take the bacteria, extract it, inject it into the rabbit, take the antisera. There is no reactivity. The same way host cell DNA. Host cell DNA endotoxin. Endotoxin you will be knowing. This is from bacteria, and there should not be any endotoxin present because it is to be injected into the eye. See. Then the product related impurities and sterility assessment and confirmation, because it is going to the eye. When we went for US, this thing, they are least bothered whether your molecule works or not. Even the regulators are not interested. They are only interested in one thing: is it safe or not? So whatever is regulator, if this is not working, the company will never go ahead, because they know the moment it is introduced, it will fail, miserably will fail. So the company will not go. What regulator is checking? It doesn't matter. Your molecule you can go with any molecule as long as it is safe. It is because it is to be given. That's why very first time a very small number of human beings are given phase 1 as an escalating dose. So this is purity. You can see a single band which is compared to lucent, exactly same. So this is our formulation, very simple formulation. Now very interestingly, at 37 degree also this molecule is safe, and you can see the stability of the molecule after 3 years. Now it's almost 4 years now. This is what we have done, an efficacy trial in human. This animal model was only available in the US, and you can see Fab 201 and Lucentis, on the other hand, vehicle. So very, very effective molecule. You can see comparisons. Formulation, this is the final. This is the one which is going for the clinical evaluation injection to the US. I think this is the toxicity studies. This is material. This is our CGMP lab. and we are going to do, we are first submitting in US. Probably after getting that number, either in US or in Australia we'll do. This is a, how this molecule is going to be far superior than any existing molecule. We have the complete data. Thank you. This is our team working together for this molecule. Thank you very much. I hope some questions. I know the topic what I have given is very complex. And as I mentioned that nobody does this type of things. But you definitely will be having some simple questions.
So, my question is, this normally for a new drug development, almost 40 resistance, antibiotic resistance. Is that true, that statement? Companies are not going for developing new antibiotic drugs due to this resistance problem.
The first question is about, can I have this? First question is that, it takes about 14 years. True. Right now the drug discovery development part is done by only small companies. What the small companies do is that, they only will be able to, because, if you are doing in a very big company, the team is big, complexity is so much, it is better to do like this. What we do is that after phase 1, because the cost of phase 2 and phase 3 is atrociously high. In the US to do phase 2 and phase 3 is almost $800-900 billion. Because in phase 3, 5,000 people have to be done. So what you do is that, after phase 1, the molecule will be sold. So there is a process is there. That is what we are also going to do. We are just waiting for phase 1. We don't have the ability to do phase 2. Even big Indian companies don't have. Because they need to take a risk. If it is small molecule, it will fail. Okay, so that first question, the cost. Now, second thing is that about antibiotic resistance. For example, Clostridium difficile associated, hospital-acquired diseases, Now, antibiotic resistance come how? Because normally what will happen, some kind of mutation takes place. Okay? Then what will happen? If you take the drug the bacteria will be having an enzyme which is to detoxify. It's one of the easiest way to explain. Now, my understanding is that many companies are involved in developing drugs for example, CDAD. So it is not that people are trying to find out what is the reason, but the way it has changed now. It is not using small molecule. It is based on antibody. The antibody will be injected. So, because that will not create any kind of this resistance problem. Antibody, just like how vaccine, like a viral disease, you have 2 treatments are there. If you want to prevent, vaccine. After getting that, there are many, this thing you can give antibody provided you have produced already the antibody. The same way for the people are developing antibody against these type of bacteria like Clostridium.
So you have developed biologicals, is it? Biologicals. So what is the difference between that synthetic drug discovery and biological, which will be more cost effective and it will less time consuming?
Now, the first which I mentioned, synthetic drug discovery normally means small molecule, which is the drugs are synthesized. Now, biologics is originally developed by antibody development. Now it has fast display, but now it is called synthetic biology. What I am telling is all synthetic biology. So in both the cases, synthesis is there. In the second case, synthetic biology is through synthesis of DNA. Once that fast display, you identified the sequence, then the whole thing is synthesized. this actually is called synthetic, and synthetic biology is coming up. So the only thing is that the synthetic new molecules is coming down because of the complexity, and the failure rates are very high. And people have been trying to develop for various conditions. What will happen during phase 2, phase 3? It fails. And if 100 molecule goes to a phase 1, only 20 molecules. As I mentioned, 10,000 molecules are required to get one molecule, that is synthesis. But then once it enters into clinical trial, only 20% success is there. But biologic is not like that. The biologic failure happens at the early stage. If you remember that complex thing, fast display. For example, many people are failing to express sufficient quantity. But we never had that type of problems. I can tell you that, we are really lucky to get all the things done properly. That means if you really concentrate, focus on that, things can be done properly. That's what I felt. Yeah.
Injections you are applying for this treatment. Why can't you try in those solutions?
Right. See, transdermal, transcellular, people are trying for a long time because it's a protein molecule. Okay? No protein can given orally. Now that is the same case with eye also. Any protein beyond, tri, tetra, peptide, peptide will not go inside. Will not be possible. This is 500 amino acids. No way it will go. Only way is injection. There is no way. But you know oral insulin. Have you heard of oral insulin? That is a possibility. You know why? If you see the intestinal epithelial cell or any cell, there is something called trans and paracellular. What is paracellular? Between the cells, there is a it is called zonula occludens. Zonula occludens. There is a, this is two cells, it is like this. And in between also passage is there. Transcellular is there through the cell, that can be energy dependent, non-energy dependent. Paracellular it pass, it is non-energy dependent. If this paracellular permeability at conditions increases, for example, it has been shown the absence of calcium, it can cause some infections. That's why many times, for example, in the case of in an alcoholism, in the alcoholics, there is a particular bacteria prevalent, Staphylococcus, a particular species, and you might have noticed what is the connection between alcohol and liver disease, liver cancer. You know why? What is happening? Actually, alcohol does not do anything, because by the time it goes, it becomes acetaldehyde getting into the metabolic pathway. But if you continuously drink alcohol, a staphylococcus, a particular species comes up, bacteria. There is a lot of bacteria in the gut bacteria. And because of this alcohol, this acetaldehyde percent, that increases the paracellular permeability, and this bacteria grows. This bacteria activates the liver, and they can get, so many of these alcoholics get liver disease. This is the main reason, a large percentage. So the question is that you can't, protein has to be somewhere or other, but through intestine, transcellular, paracellularly, it is possible. People are trying, and there is a, for example, there is a drug or chemical called thioperamide. I think increases the paracellular permeability, but it may not be a dream. It might happen probably few years, like certain protein molecule can be given orally. There's a several billion-dollar question. Memory enhancing drug. I also feel that, I get, it would be good. Everybody has a problem. They think that, their memory is poor. Okay. So there are two things. Age-related memory problem. It's like, many people forget the names. That's one thing. Alzheimer's disease is a different thing. Okay? Now, as far as Alzheimer's disease is concerned, unless you know the mechanism, what is the mechanism? If I see you, and if I go outside, I will be able to visualize this. That means, just like a photograph, something has gone into my brain through eye. So what is happening? That visible radiation falls somewhere, translated, and I will be able to recollect. For example, if you see any music, once you hear, then you will be able to get it back. So that is somewhere embedded. How it is embedded, nobody knows. Is it some structural alterations in some of the proteins? Many theories have come. To me, unless that is identified, you will not be able to find out a drug rationally. But on the other hand, many targets have come, as I mentioned, NMDA, acetylcholinesterase, cholinomimetic, gamma secretions, 4 or 5 targets with animals and other things. Many drugs have come, everything is miserably failed. But I will tell you, if memory enhancement takes place by 10%, especially in Alzheimer's, that can be a blockbuster drug. Just like, in pancreatic cancer, anything that the patient can live, after identification, most people die in 1 month to 6 months. If we can increase by 10-20%, that will be another blockbuster. But mechanisms are not. So in Alzheimer's disease, I don't know. Now, for right. If you see, omega-3 means EPA, eicosapentaenoic acid, which is present in the fish oil, EPA, DHA. That has been taking for the last 100 years or 70, 80 years for various things. That is depression, schizophrenia, inflammatory conditions, but only one thing which is proven. This allopathic medicine is called evidence-based. Earlier it was like, allopathy, then what is the other thing? Then finally now it is evidence-based. You need to have evidence. You can't just like that discover a drug. You need to have what is the structure, where it goes and binds. Everything should be evidence-based. If it is not there, nobody approves, definitely. You can't do things with intuition. It is not like homeopathy. It is not like Ayurvedic product or some very clear-cut clinical evidence has to be there. Then only this thing. As far as EPA, DHA is concerned, so many theories, in vitro also is there. But only one thing, it is proved beyond doubt, that is for triglyceride reduction. And if you see, there is a drug called Lovasa, which is EPA, fish oil, esterified fish oil. That's the only thing. Many other things. Curcumin. I also have 30-40 patents is there, bioabsorption. But there is no efficacy has been shown till date. Everything is in vitro data. In a clinical efficacy, just like what we have to do in a 3-phase and multiple centers, multiple people, then only anything will become a drug molecule and there is a disease claim can be. This is totally different. Biosimilar is something different, biomarker is something different. Biosimilar, any novel biologic which became off patent and anybody can make, just like generic molecule, that is called biosimilar. Biomarker, for example, glycosylated hemoglobin is a biomarker. Or any of these enzymes, molecules, any of these things for a disease to establish. For example, cancer antigens can be detected in this thing, that is a biomarker. So these are no connection, biomarker and biosimilar. I wish some students ask some questions.
Anybody have any question? So that ends today's session, sir's section, because he has given a very extensive and elaborate discussions. Actually, and I think 90% of the those who are sitting here as maybe students, those who have PGs or PharmD or B.Pharm students. So this may be a very interesting. This is you may learn this type of activities are happening in pharma field. So sir has given an extensive talk, and first of all, we'll give a thanks to sir for accepting for this function. Being as a part of a organizing committee, I am giving once again thanking you, sir, for accepting us coming here for delivering the talk. And I also express my thanks to Varma sir and other faculty members and team members for inviting me for these sections. And thank you once again.
Thank you, sir. Really, it was very interesting and informative session. We request Dr. Kiran SS to present momentum to Dr. C.N. Ramson. Thank you, sir. We request Dr. Sujit Verma K, Principal, College of Pharmacy, to present certificate to Dr. Kiran SS. Thank you, sir.
Now we'll have a break and we'll come back by 2. 1:50. 2 break.
Attention please, lunch is arranged at the pharmacy college and we have a bus service from dental college to pharmacy college. Students can avail the bus service and be back in the hall at 2.
Expediting Drug Discovery, The Role of Software in Streamlining the Process by Dr. S. Kavimani. Before moving to the scientific session, I would like to introduce the session chair, Dr. Agash Maradagam, Professor and HOD, Department of Pharmaceutical Chemistry, National College of Pharmacy. He has more than 15 years of experience in academics and he has several publications to its credit. He has conducted and attended several seminars, conferences and workshops. He is a member of the International Society for Evolution and he is a life member of APTI. We invite you, sir, to chair the session.
So, good afternoon all. First of all, it's my privilege and our college privilege that we have a speaker like Dr. Kavimani sir here. Let me say a few words about Kavimani sir. Kavimani sir is working as a professor in Mother Teresa Postgraduate and Research Institution, Pondicherry. He has an illustrious career. He is member of Board of Studies, Pondicherry University, Tamil Nadu University, Manomanian.
The guide by using some software approaches. So before going for my lecture, since I am the member of Pharmacy Council of India, I would like to give some of the informations. That is, the March 6 is celebrated as Pharmacy Education Day. From this year onwards, for that is 2023 onwards, the Pharmacy Education Day, PCI will celebrate the Pharma Anvation. The Pharma Anvation is a student and a staff member. The aim of this Pharma Anvation is, if you have any idea, innovative idea, that you can share with the Pharmacy Council of India. Why? Because in this particular Pharma Anvation, each and every year, March 6th will be celebrated as Pharmacy Education Day. On that day, Pharma Anvation will also be there at Delhi. Okay, so if you have any innovative idea, we can express. This is the format. For staff members, if you have any granted patent, having some, but you are unable to commercialize it. We have patent, but unable to commercialize it. So we can explore that patent in that particular Pharma Anvation, where more than 600 company peoples will come. Big companies, well-reputed companies, industry people will come to that pharma innovation, so that we can explore your innovations for commercialization purpose. The second one is if you have any design patent, granted design patent. For example, we have devised an instrument, a simple instrument, something like that. That also you can explore with these industry people. The third one is for the student category, that is for promising research. Promising research, for example, if you can able to synthesize newer lead molecule, that can be explored in that particular meeting. So like that, 4 or 5 people known to me, they have commercialized their super disintegrant in pharmaceutics for using some super disintegrant. Right, that disintegrant taken up by the industry people, so that you will get the monetary benefit from that meeting. The second one is B.Pharm and M.Pharmacy students. The PCI has launched a job portal for pharmacists, like LinkedIn, where you can your resume uploaded in this job portal. Please, today you go to PCI website and find out, okay, where you can upload your resume. So, here what happens, PCI has signed a memorandum of understanding with 5 major organizations, that is LSSDC, Life Sciences Sectors, Skill Development Council, Ministry of Skill Development and Entrepreneurship, Karnataka Drugs and Pharmaceutical Manufacturers Federation of the Pharma Entrepreneurs and Indian Pharma Alliance. So these 4 associations is totally associated with more than 6,000 manufacturing industries. So if you can able to upload your resume on that web portal, the 6,000 manufacturing industries can able to see your website. No need to go for newspaper, no need to go for applying for particular job. Just to upload and wait for some time. Definitely they will call you. Okay, so this information I would like to give as a part of a member of Pharmacy Council of India. Another one is, what is the importance of attending this type of seminar or conferences? Up to last year, there were 3,600 pharmacy institutions all over the country. 2022-23, there were 3,000 pharmacy institutions, from where 4 lakh pharmacists are coming out each and every year. 4 lakh pharmacists are coming each and every year from these colleges. What happened this year, This year, more than 2,500 institutes has applied to the Pharmacy Council of India. So 3,600 plus 2,500 institutions are there in India. So we should be very competitive enough. We have to acquire knowledge by attending this type of seminar. So I congratulate the management for conducting this type of seminar. So this is the part I would like to give from PCI point of view. So with this small introduction, now I will be moving on to this my lecture. This is software-based approaches for drug designing and development. So why we should go for software? There are 5 R concepts in usage of animals. Without animals, there is no drug development. As you know, for preclinical trials, you require animals. But because of the stringent measures taken by CPC, SCA, we are unable to utilize many number of animals for the preclinical trials, research and development. So as a part of CPC, SCA impact, we are following the 5 R concept: reduction, refinement, replacement, rehabilitation, and responsibility. This is 5 R concept in utilization of the animals for the experimental purpose. The first one is reduction. As much as possible, number of animals utilized for the experimentation purpose or research purpose has to be reduced. How it can be reduced? Instead of checking all the synthesized compounds, all the natural products in animals, initially we can go for the software approaches, so something like molecular docking studies. If it succeeds with the molecular docking studies, those compounds can be selected and that can be checked in the experimental animals. This is called reduction. Refinement, without giving much stress to the animals, by usage of euthanasia or anesthesia, how we can do the experiment. That is called the refinement. Replacement is use of softwares for the demonstrating purpose. We have many number of softwares for demonstration of pharmacological experiment like XPharm2, Xcology. So these are the softwares. Cardiolab is the software. Microlabs is the software. MedWatch is the software. So by using this software, the practicals can be demonstrated for B pharmacy students or M pharmacy students. But my approach is software, usage of software for drug designing and development. In this introduction, we'll go for the network pharmacology. So what do you mean by network pharmacology? It is broadly classified into three. One is usage of traditional medicine for the drug discovery. The second one is pharmacological aspect, and third one is how these traditional medicine and pharmacological approaches are orienting towards the drug research. We will see one by one. Traditional medicine, we have to scientifically validate the folkloric claim. If we say this is for this, but it is not scientifically explored. So our duty is either in the practice school or in the project work. We can scientifically validate the usage of traditional medicine for the treatment of various ailments. How understanding the rationale of traditional formulation, how these compositions were made. For example, anti-diabetic formulation have number of components. How these formulations were made, on what basis this composition has been given, and find out the mechanism of action. For example, it is anti-diabetic formulation, whether it is for type 1 diabetes or type 2 diabetes, whether it stimulates the pancreatic beta cells or it aggravates the action of insulin. So find out the mechanism of action. Now, fourth one is network-based designing. The fifth one is analysis of multiple bioactive compounds. If you go for GCMS of a plant extract, you will have number of components in that. So that has to be, that is called bioactive guided fractionation. The next one is development of botanical biomarkers for the quality control. So this is in network pharmacology, traditional medicine aspect. The second one is pharmacology, to develop newer and lead molecules from the natural sources, Taxol from the Taxus periflora. Understanding the mechanism of action, whether it is receptor oriented or enzyme oriented, what will be the ligand, what will be the target. The third one is determining the possible adverse drug reactions. The fourth one is predicting the new indication. Here we should have more importance, predicting the new indications. In 2019, November, COVID-19 has come. As you know that for the drug discovery process, minimum 14 years we have to spend. But 2019 COVID has come. If you go for medicine for COVID-19, only in 2034 you will get the medicine. But 2020 January itself, Remdesivir have been utilized for the treatment of COVID-19. Remdesivir is for pandemic flu, influenza. It is used for the treatment of influenza virus. By means of molecular docking studies, we can able to find out what is the binding capacity of this Remdesivir on the COVID-19 coronavirus. So that is called predicting the new indications of existing molecules. In aspirin, 135 years old. The age of aspirin is 135 years old. An apple per day keeps all the doctors away. An apple per day keeps the doctors away. Now, an aspirin per day keeps all the cardiovascular complications away, because aspirin is an antiplatelet drug. It inhibits the aggregation of the platelets. So this is predicting the new indications of existing drugs. You can say it is drug repurposing. How Remdesivir is repurposed. How hydroxychloroquine is repurposed for the treatment of coronavirus. Hydroxychloroquine is disease modifying anti-rheumatic drugs. Hydroxychloroquine. It is an anti-malarial drug, but it has been utilized for the treatment of COVID-19. That is called the repurposing. When you come for drug research, identifying the novel drug target is very much important. As you know, you are all very basic pharmacology. I would like to say a drug should have both affinity and intrinsic activity. Affinity means the ligand should have affinity with the target. The ligand should have affinity with the target. So how? Now we are going to identify the novel drug target. What is novel drug target? Druggable genomes are only proteins. Our enzymes are made up of protein, our receptor is made up of protein. Most of the drugs are acting on G protein coupled receptor, GPCR, because proteins are the druggable genome. So in molecular docking studies, we are going to dock it with the proteins. We are going to dock it with the receptors or with the enzymes. Enzymes and receptors are made up of protein. Reducing the cost and time through in silico evaluation. In a preclinical trial, if you use animal, you know how many days it will take to find out the toxicity. But we have a software, DocsWatch. So with that, within 10 minutes, you can able to say this compound may have this kind of toxicity. That will come later. Understanding the signaling pathway of disease type. The cells are communicating each other. Cells are communicating with each other. That is called signaling. Second messengers. So what are the second messengers involved in that particular disease or particular drug mechanism? Discovery of disease causing gene is very important. This disease causing gene. Almost 40% of the fertile women in India have been suffered by one or more complications in their menstruation, either over menstruations or no menstruations. It's all due to overexpression of the HER2 gene. That's a gene called HER2 gene. Overexpression of the HER2 gene leads to estrogen affinity that is responsible for the development of cyst in ovary or fibroid in the uterus or the carcinoma in the breast. All that, the one reason is overexpression of the HER2 gene. So that is called therapeutics for multi-gene dependent diseases, discovery of disease-causing gene and diagnostic biomarker and studying the drug resistance or antibiotic resistance. So this is the three main aspect of the network pharmacology. Now I am coming to the original title, software used for drug discovery process. First software I am going to discuss is IMPAT, IMPPAT. It is nothing but Indian medicinal plants, phytochemistry and therapeutics, which is divided into three parts. Section A deals with the phytochemicals which is present in the Indian medicinal plants. The second one is what will be the therapeutic uses of those phytoconstituents. The first part exposes the phytochemistry. The second part exposes therapeutic uses of those phytochemicals. The third one is what all the formulation is possible from part A and part B. So please go to this website, this database, and for better review of literature for your practice school or for your project work, please use this particular software if you are interested in plant-based project work. This is another database, TCMSP, Traditional Chinese Medicine System Pharmacology. Now, you should listen very carefully. At least you try to note the name of the software, name of the database, so that you can refer in later on. Traditional Chinese Medicine System Pharmacology. This is the Paka software. You know, these have 500 Chinese herbal medicines. 500 Chinese herbal medicines with 29,384 ingredients, phytoconstituents. That many phytoconstituents is there out of these 500. Different phytoconstituents are there in 500 Chinese herbal medicines with a target. You see, 3,300 targets. Cyclooxygenase is one target. Xanthine oxidase is one target. Carbonic anhydrase is one target. Like that, We have 3,311 target in this particular software with 837 associated genes. How the genes are associated with the diseases. So there are 837 genes which is associated with the major diseases. Now this is the first page of the website, Lab of Systems Pharmacology. Lab of Systems Pharmacology, where it is possible, here you can make a search, either by the help of name of the herb or by means of chemical name or by international chemical identification key or chemical abstract numbers, target name, disease name. It is divided into 6 categories. The searching is possible on 6 different categories. Now here you see, the search is divided into 3 parts. A part, B1, B2, B3, C1, C2, C3 and C4. How we are going to search it? How we are going to use this particular software? The B1 deals with the compound information. If we click that particular compound, then the link will goes to PubChem directly. In the PubChem, we can take the canonical smile of that particular compound. PubChem, structure properties of the compound, ADME properties, absorption, distribution, metabolism, elimination properties, then HCTD means helps compound target disease. Helps compound target disease. These references you can get from the B1. This is compound information. The second one is target information. The compound should have affinity with the target. Compound should have affinity with the target. You know, all the keys can enter into lock, but only one key can able to open the lock. It is the lock and key mechanism. All the compounds may have affinity with the target, but not intrinsic activity. By using software, we can study only the affinity, not intrinsic activity. That's what it is. It's a prediction. It is a prediction. The prediction may goes to wrong also when you go for the preclinical trial in the animals. And target information. If you click the target information, that will link to the drug bank. What are all the drugs available? What are all the phytoconstituents available? Everything. The target name and again helps compound target disease references. Now B3 is the disease information. You are classifying the drugs, but you are not classifying the disease. If you go for M-Pharm pharmacology, then we have a separate chapter, international classification of the diseases. International classification of the diseases. For example, respiratory disease is one heading, under which bacterial respiratory diseases, viral respiratory diseases, these are all subdivisions. So, we are following ICD-9, International Classification of the Disease 9. But recently, International Classification of the Disease 10 also introduced. So, compound information, target information, the last one is disease information. So, that will go for compound screening of a herb, compound target network, target disease network, finally the network analysis. So by using this traditional Chinese medicine, system pharmacology, you can get all this information. Now the continuation of that, you take licorice, carbinoxylum, which is the compound isolated from the licorice. That carbinoxylum sodium is the ulcer site protective agent. It is used for the treatment of ulcer site protective. So licorice, the botanical name of licorice is Glabra, that have ingredient in it, 280 ingredient in it, right? A constant. By using ADMET screening, ADME, I will give separately what is ADMET, ADME screening. Out of 280 compounds, 69 compounds have been found to be active. 69 compounds. And these 69 active compounds have been targeted with the specific target and disease, right? So, topology analysis, functional characterization, hypothesis-driven analysis. If you follow these three, definitely you will get the effective compounds with the potential target and related diseases. So far I have discussed only one database for discovery of diseases. Now here you can see the existing molecule. The first thing is, what is the rationale behind the selection of your particular project? You say all the allopathy system, all the drugs in allopathic system of medicine is having potential side effect. So I want to replace that with the natural medicine. That is our answer. Now you can see here, I have divided into two. One is the natural product, another one is the drugs of clinical importance. The drugs of clinical importance, in sense, it is allopathy system of medicine. That may be under approved drugs or under phase 2, 1, 3 or investigated, whatever it may be, it is a allopathic drug. Okay. So now, what is the drawback of allopathic drugs? There will be limited therapeutic effect, adverse drug reactions, and development of drug resistance. These are three important drawbacks of the existing medicine, the existing system of medicine. How it can be overcome? You come here, this is natural product. It may be obtained from various sources. As you know, we have been discussing what are the sources of the drugs. So natural product. So the drugs of clinical importance is combined with the natural product. So what will be the result? There will be augmentation of the therapeutic efficacy. There will be decreased adverse drug reactions, and there will be delay in the development of resistance. So this is the advantage of combining the natural product with these drugs of clinical importance. So I would like to give some examples. Curcumin. We know curcuma longa. It has multiple therapeutic effects. One of the therapeutic effect of curcumin is it can be used for the treatment of various types of cancer. Curcuma longa. 5-fluorouracil is an antimetabolite. You know, 5-fluorouracil is an antimetabolite. So all the anti-cancer drugs are said to be cytotoxic. Even though many number of antibiotics are cytotoxic, we are saying that cytotoxic in sense anti-cancer drugs, because anti-cancer drugs kills our own cell, whereas antibiotic kills the foreign cell. Okay, now this 5-fluorouracil can be combined with the curcumin for the treatment of colon cancer, stomach cancer, breast cancer and prostate cancer. So all these three approaches, you know, enhancing the drug efficacy, decreasing the adverse drug reactions, and delaying the development of resistance. As you know, cancer is a chronic disease. We require the drug treatment. We require drug treatment. If you stop the treatment, then automatically there will be overproliferation of this cell. In that cases, there will be development of resistance. So if you can able to combine with the natural product, there will be delay in the development of resistance. Even though allopathy system have well advanced, but there is no drug for the treatment of hepatitis. Still we are relying on alternative system of medicine. Only one hepatoprotein we are using for the doing project work is silimarin. Or leaf 52 is Ayurvedic formulation. Leaf 52 is Ayurvedic formulation. Silimarin is a chemical. So the derivative of silimarin is silibinin. Silibinin. The derivative of silimarin is silibinin, which is obtained from the plant-based product Cartus marinus. It is used for the treatment of hepatic encephalopathy, liver disease. Now, this silibinin can be combined with methotrexate, regorafenib for the treatment of colorectal cancer, sorafenib for the renal cell. If any drug can do with NIP means it is monoclonal antibodies. Varinostate, mycosis fungoides. With cisplatin, it can be combined for the treatment of bladder cancer. With erlotinib, it can be used for treatment of lung cancer, etc. So now this is the advantage of combining the natural product with the existing drug molecule. The third chapter I am going to discuss is CMNPD. It's a comprehensive marine natural product database towards facilitating drug discovery from the ocean. As you know, 2/3 of our land is covered with water. So marine. The statistics says that non-vegetarian peoples are less prone to development of myocardial infarction when compared with the pure vegetarian people. That means omega-3 fatty acid is an important antioxidant. The main source of omega-3 fatty acid is marine, fish, or marine-based microorganisms. Organisms or microorganisms are rich with the omega-3 fatty acid. Compound is having some identity or compound name or microorganism name. So different types of the searching is possible by using this particular software. Here you can see how it has to be searched. These are very simple. If you open the database, then you can able to understand what are the things which is present in that. See here, the complicated picture. In 1969, cytarabine have been introduced. Now, what is the specialty of cytarabine? If anyone says, I will be giving one compliment. What is the specialty of cytarabine? What is the specialty of cytarabine? If anyone says, I will be giving one compliment. Students? Okay. Cytarabine is the phase-specific anti-cancer drugs. It acts only